denied access to health care. These questions are coming at a time when there appears to be a little of a crisis over the provision of health care services by the private hospital health providers. And so we expect the Cabinet Secretary to shed light in regards to how the government and the private hospitals intend to end that stalemate. But that notwithstanding, the Senator for Kirinyaga County, Senator James Murango, wants the CS for Health to highlight the programs in the health sector that will be affected by the decision by the American government to withdraw funding from the aid-funded healthcare programs in the country, with particular focus on how such withdrawal affects the health sector in the Kirinyaga County. The Senator for Kirinyaga also wants the Cabinet Secretary for Health to provide a breakdown of the budget for the affected programs in the country and the action that the Cabinet Secretary is taking to ensure that critical services under the affected programs do not stop and thus avert the likelihood of putting healthcare into jeopardy both in the counties and at the national level. Nominated Senator Catherine Muma, is the last to ask questions to the Cabinet Secretary for Health. Senator Muma wants the Cabinet Secretary to provide details on the availability and affordability of life-supporting prescription drugs for persons with disability, PWDs, and the persons living with seizure-related ailments such as epilepsy. The Senator also wants to understand which pharmaceutical manufacturer, suppliers, and distributors are collaborating with the Ministry of Health and the Kenya Medical Supplies Authority, KEMSA, to ensure the availability of these medicines and what are their terms of operations. And finally, she wants to understand the steps that the ministry has taken in place to ensure that these life-saving drugs are included in the essential drugs list and are made readily available under the existing public national health insurance schemes. The CS for Water, CS Eric Muga, is also expected to appear before the Senate plenary this morning, being a day set aside for Cabinet Secretaries to appear before senators to answer questions of concerns raised by members. Senator for Migori County, Senator Eddie Okech, wants the Cabinet Secretary for Water, Sanitation, and Irrigation to provide a list of landowners who granted way leave for the Lower Kuja Irrigation Development Project in Nyatike Sub-County. The Senator also wants to understand why has the government not paid out compensation to them years after the project commenced, and could the Cabinet Secretary explain the inordinate delay in the completion of the project? If you're just joining us, the business of the Senate is just about to commence as the Sergeant-at-Arms with the mace has already stepped into the chamber. The Deputy Speaker of the Senate, Honorable Kathuri Murungi, will be presiding over this business of the Senate this morning. Allow me to hand over for this live broadcast. My name is Gladys Mungai. Enjoy your viewing.
Tuombe. Ewe Mwenyezi Mungu, twakusihi tutazame kwa neema nyingi na baraka sisi watumishi wako ambao umeridhika kutuita kwa nyadhifa za uongozi katika jamhuri yetu. Twakuomba utujalie tuyatende na kufikiria mambo yote yatakofikishwa mbele yetu kwa njia ya haki na uaminifu, ili kustawisha amani, ufanisi na heri ya nchi yetu na wale ambao haja zao umezikabidhi mikononi mwetu. Amen. just confirm, Mr. Clerk, whether we have quorum. Sergeant at Arms, ring the quorum bell for 10 minutes.
Has commenced this morning, and on your end, that is a quorum bell for senators to have a little time for this. For those yet to make their way into the chamber this morning, it is a quorum bell for 10 minutes as directed by the Deputy Speaker of the House, currently presiding over the business of the Senate. And as we await for a signal from the chamber to ascertain if the House has numbers to commence business this morning, before I handed you over to the live proceedings, I was taking you through some of the questions that a number of cabinet secretaries that are set to appear before the House this morning will be expected to answer. And the Cabinet Secretary for Health will be responding to further questions by Senator Hamida Kibwana. Senator Hamida wants the Cabinet Secretary for Health to tell the House whether the medical interns have been paid their monthly stipend up to date. And if not, could the Cabinet Secretary explain the delay and state when the government will streamline the process and guarantee timely payment? Senator Hamida also wants the ministry to tell the House what it's doing to improve the working conditions of medical interns who currently handle heavy workloads and work for extremely long hours under intense psychological pressure. And equally, the CS for Health is required to provide an overview of the support systems and programs currently being implemented by the government to address the physical and mental well-being of the medical interns. And finally, under questions by Senator Hamida Kibwana, the CS for Health will be required to tell senators this morning what the government is doing to ensure that the mentorship program of medical interns effectively integrates both professional development and emotional support. The last question is a question by the Senator for Makueni County, Senator Daniel Wanzo, who wants the Cabinet Secretary for Water to provide an update on the status of the construction of the Thwake Dam in Makueni County and explain why the construction works have stalled. The CS is also required to tell the House the measures the government has put in place to ensure a timely completion of the dam, and could the Cabinet Secretary give such a timeline on when the Thwake Dam shall be completed? And so away from the question by members of the Senate this morning to the relevant Cabinet Secretaries, being the Cabinet Secretary for Water, Eric Muga, and the Cabinet Secretary for Health, Deborah Barasa, who are set to appear before the Senate this morning. The leader of the majority party will be expected to table papers this morning on matters to do with the financial statements of various county governments. There are about 36 reports that are set to be tabled by the Senate leader of the majority party, and these are audit reports from the Office of the Auditor General. The report of the Senate delegation to the high-level political forum in 2024 on matters sustainable development is set for debate this morning. This report is by Senator Hamida Kibwana yet again.
Confirm now we have quorum. Let's transact business. Clerk, read out the first one.
Order number 1, administration of oath.
Sergeant at arms, we have quorum now. You can stop the bell. Next order.
Order number 2, communication from the chair.
Honorable Senators, we have visiting teachers and pupils from Precious Blood Primary School in Kiambu County. Honorable Senators, I would like to acknowledge the presence in the public gallery this morning, visiting teachers and pupils from Precious Blood Primary School in Kiambu County. The delegation comprises 4 teachers and 85 pupils who are in the Senate for a one-day academic exposition. Honorable Senators, in our usual tradition of receiving and welcoming visitors to Parliament, I extend a warm welcome to them, and on behalf of the Senate and on my own behalf, wish them a fruitful visit. Thank you. Kiambu County. Majority Leader, maybe welcome the visitors.
Thank you, Mr. Speaker. On behalf of the Senate, I join in welcoming these students from Precious Blood in Kiambu, who are here on a visit and a study tour of the Senate. This is the Senate of the Republic of Kenya. Sometimes you come like this, other times it erupts. So I don't promise that we'll be this calm, the entire session will be here. But just in case that it remains this calm, know that it's normally a very sober house. We reflect, we pass laws here, we debate, we represent you, and that is, by and large, the work of legislators. I hope that you will get to enjoy the full value of the time that you'll spend here, and looking forward to having some of you in this house in the future representing the people of Kenya. Thank you, and most welcome.
Next order.
Order number 3, messages.
Next order.
Order number 4, petitions.
Next order.
Order number 5, papers.
Majority Leader.
Mr. Speaker, sir, I beg to lay the following papers on the table of the Senate today, Wednesday, the 26th of February, 2025. These are the reports of the Auditor General on the financial statements of Homa Bay County for the year ended 30th June 2024. This is a County Executive, County Assembly, County Revenue Fund, Receiver of Revenue, County Executive Car Loan and Mortgage Members Scheme Fund, County Assembly Car and Mortgage Loan Fund, County Emergency Fund, County Education Bursary Fund, County Alcoholic Drinks Control Fund, Municipality of Homa Bay County Teaching and Referral Hospital, Ogongo Level 4 Hospital, Magunga Level 4 Hospital, Nyangiela Level 4 Hospital, Kisegi Level 4 Hospital, Rangwe Level 4 Hospital, Marindi Sub-County Level 4 Hospital, Mbita Sub-County Level 4 Hospital, Suba Sub-County Level 4 Hospital, Homa Bay County Water and Sanitation Company. Reports of the Auditor General on the financial statements of Elgeyo Marakwet County for the year ended 30th June 2024, the County Executive, County Assembly, Receiver of Revenue, County Executive Car and Mortgage Revolving Fund, County Assembly Car and Mortgage Revolving Fund, County Education Fund, County Assembly Catering Services Revolving Fund, Elgeyo Marakwet Alcoholics Drink Control Fund, Elgeyo Marakwet County Government of Financing on Locally Led Climate Action Program for 15 months period, Iten Tambach Municipality, Iten County Referral Hospital, Chebiemit Level 4 Hospital, Tambach Sub-County Level 4 Hospital, Iten Tambach Water and Sewerage Company Limited, Cherangany Marakwet Water and Sanitation Company Limited. Mr. Speaker, I beg to lay.
Thank you, Emil. Next order.
Order number 6, notices of motion.
Next order.
Order number 7, questions and statements.
Honorable Senators, as you can follow on your order paper, today we're expecting 2 CSs, the CS for water, Eric Murithi Muga, and the CS for health, Dr. Deborah Barasa. It is in my notice that the CS water is accompanying His Excellency the President in the Mombasa working tour or trip, and therefore he has requested the Senate to indulge him so that he can try to sort out the water issues in Coast region. Noting that the Coast is a water scarce counties. From my seat and SBC, I think we have agreed with his request. But also to request him to note that the next time that he's available in this town, he should appear before the Senate to answer the questions from the senators. Then also we have the CS for health, Dr. Deborah Barasa. I'm told she's around, and therefore we'll start with her with the 4 questions that is directed to her. So you can request the CS before she comes in. Yes, Majority Leader.
I beg for your indulgence so that we can dispense of this letter from the CS for Water, Engineer Eric Murithi Muga. Just to note that I agree with you that what the minister is saying is important, but also what he was supposed to come do here is equally as important. You know for a fact, Mr. Speaker, that a president's visit is not a thunderstorm that appears out of the blues. It is something that is planned weeks in advance, and the minister was aware. He knew that he was supposed to be here today. Therefore, on all other accounts of things that we have raised in the past, that it is a minister who should respond, that he has done, that it should be in writing and not an SMS to the Speaker, that is done. But there is a very cardinal principle that this minister is violating. You are supposed to notice, to issue notice to the Senate at least 7 days before the date of your appearance. That's why even us as a House, we don't ambush anybody. We write to you 7 days prior to your appearance. Therefore, I want to request, Mr. Speaker, that you direct that Secretariat sends a response, actually, to the Minister that this is not acceptable. The President's visit is not impromptu. It was long planned, and therefore, he should have been diligent enough to respond early in advance. Therefore, Mr. Speaker, you know why I'm insisting on this, Mr. Speaker? If we had this letter, when we sat at SBC last week and scheduled these questions, we would have known that the minister wouldn't be here, and therefore would have gone to invite another cabinet secretary. Therefore, I find on behalf of the House, Mr. Speaker, that this is still not acceptable. That Secretariat must respond to him and let him know. Perhaps he be issued with a last warning before we can proceed to do that which the powers and privilege provides us to do, that you cannot write a letter to an institution barely hours before your appearance and expect that that institution will find that acceptable. It is not, Mr. Speaker. I thank you.
Leader of the majority party in the Senate. I don't want us to open this debate because I said it is a bit reasonable that he has not appeared. But I said any time he's around this city, he should appear before the Senate to answer his questions. Honorable Senators, this gentleman is the first offender. He has never, because this is the first invitation. I'm very much aware. It's the first invitation, and we should be lenient with the CS, yeah, and encourage him, that he should be able to do what the majority leader has requested him to do. Yeah? So, because of the respect that we have even within Gen Zs, I don't want us to open that debate. Let us use Maybe I give only one reader from the minority side to balance. Yes? So you are agreeing between the majority minority reader and the majority minority whip? Yes, Senator Sifuna. Honorable Senator, I think it's important that we should give the chair time to guide the House. And that is the spirit. That is the spirit.
Thank you. Honorable Speaker, I thank the leaders on our side for handing this responsibility to me. Honorable Speaker, I know that the Cabinet Secretary for Health is here, and Senator Wambua is one of the people who has questions to put to the CS. I am sure he will get opportunity to say what he wants to say. But for me, Honorable Speaker, I was holding brief for the Senator of Migori, who had a question to the CS for water regarding the Lower Kuja Irrigation project. Honorable Speaker, this is the one CS I have never seen. I don't know how he looks like. If we met in the streets, I wouldn't know who the CS for water is. I don't even know his name, Honorable CS. I was looking forward to see his face. And the majority leader, I think there should be an induction, even when you say he's a new CS, there should be an induction for CSs. Part of the problem why your government is struggling, Honorable Majority Leader, and the President has said it. No. The President has said it himself, that he struggles to be the only person communicating government policy. And it is true. Because who is this person who holds this docket of water? I don't know him. I don't know if that gentleman walked in. Maybe he's even present in this house. Nobody knows who he is. We were just asking ourselves here, amongst the minority leadership, Honorable Speaker, is he a man? Is he a woman? Nobody knows. So, Honorable Speaker, we want to say this. We are disappointed, and we always record our disappointment. But if we want to understand the government policy, we need these cabinet secretaries to interact with us. Yesterday, I ran into the former CS for Energy, David Chirchir, one of the most astute and one of the few cabinet secretaries that I respect, because he interacts with members of this house. He explains government policy. Yesterday, I was saying, if he was still in that docket, I am sure the drama you are seeing in Nairobi of the Nairobi County government dumping garbage outside the Kenya Power offices and Kenya Power retaliating by cutting power to the county government offices, you would not see those things because he would take leadership. Honorable Speaker, if you look at the relationship between county governments and national governments, they are supposed to be cordial. Where you see a cabinet secretary, there is a fight in your docket, but you do nothing at all. All you talk about is 2027 politics. You have failed as a cabinet secretary. So, Honorable Speaker, we want this gentleman to at least appear. Let him not fear this house. We want to be his friends, at least from the minority side. We want to confirm that we mean well. We want to have a discussion with him about these water projects. Let him not shy away, and let him be trained that if there is going to be an event that takes him away from the capital, he should communicate early, as the cabinet, as the majority leader said. Thank you, Honorable Speaker.
Yes, I agree with you, Honorable Senators and leadership, but you should learn as fast as possible that communication is very key. And there is nothing impromptu, as the majority leader said. So the CS has been guided accordingly by the Senate that he should be communicating early enough. And you said you don't know his name. He's not Hashim, but he, Engineer Eric Muredi Muga. Yes. And I represent him in the Senate, but not on this matter. Yes, because I'm the Honorable Senator for Meru. Yes. Elected by majority vote in Meru, more than 350,000, out of the 400-something thousand voters that didn't vote. But I agree with you, we didn't need respect as the Senate. Even if he is my brother, he didn't need to handle Senate with a lot of respect and decorum. He has no choice. Therefore, if the CS is around for health, you can now welcome her to the Senate. Okay. Honorable Senators, the CS for Health is here. Dr. Deborah Barasa and your team, welcome to the Senate of the Republic of Kenya. And you are here to interact with the 4 questions that the Honorable Senator has raised on this floor. And I can see you are prepared and your team to answer them. We start with the question number 016 by the nominated Senator, Senator Catherine Muma, who is also going to represent the Speaker in another forum in the next few minutes. So let's first dispense of your question. Senator Catherine Muma.
Thank you, Honorable Speaker, for giving me this opportunity. My questions to the, and welcome CS Baraza to the Senate. We've been longing to ask you a number of questions. I'm glad you've managed to come this time. My first question is, could the Cabinet Secretary provide details on the availability and affordability of life-supporting prescription drugs for persons with disabilities living with seizure-related ailments such as epilepsy? The second question is, which pharmaceutical manufacturers, suppliers, and distributors are collaborating with the Ministry of Health and the Kenya Medical Supplies Authority to ensure the availability of these medicines, and what are the terms of their operation? The third question, what steps has the ministry taken to ensure that these life-saving drugs are included in the essential drugs lists and made readily available under the existing public national health insurance scheme? Thank you.
CS Health.
Honorable Speakers, Honorable Speaker and distinguished members of the Senate, it is indeed a great honor and a privilege to appear before this esteemed House today. I sincerely appreciate the invitation to engage with you on the Ministry of Health's ongoing efforts to ensure the availability of quality, accessible, and affordable healthcare services for all Kenyans. The Senate plays a vital role in shaping national health policies, and I welcome this opportunity to present our initiatives and collectively explore ways to strengthen healthcare delivery across the country. This occasion also marks my inaugural appearance before this honorable House as Cabinet Secretary for Health. I take this opportunity to reaffirm my commitment to transparency, accountability, and constructive engagement with the Senate in advancing Kenya's health agenda. As we navigate the evolving healthcare landscape, I recognize the Senate's pivotal oversight role in ensuring that the government's health policies and programs effectively serve the needs of all Kenyans. As we move forward with the implementation of Taifa Care, our flagship model for achieving universal health coverage, I look forward to forging a strong partnership with this House. The success of this transformative health agenda depends on the collective effort of the executive, the legislature, the county governments, and other stakeholders. And I am confident that through close collaboration, we will make significant strides in realizing a robust, inclusive, and sustainable healthcare system for all. Honorable members, I will now move to the question by Senator Catherine Mumba. Honorable Speaker, honorable members, medicines used in the country must meet strict regulatory requirements to ensure safety, efficacy, and quality. They must be, first of all, registered and retained by the Pharmacy and Poisons Board. However, if a medicine is selected for inclusion in the essential list but is not yet registered in the country, it may undergo an expedited registration process to facilitate timely access. Secondly, it must be listed in the current Kenya Essential Medicine List 2023. Additionally, for these medicines to be available to the wider public, they need to be stocked by KEMSA as guided by Kenya Essential Medicine List 2023, Kenya Essential Medical Supply List 2023, and the Kenya Essential Diagnostic List 2023. Currently, KEMSA stocks a number of anti-epileptics or anticonvulsants, such as lamotrigine tablets, valproic acid tablets and syrup, phenytoin tablets, phenobarbital tablets and injections, midazolam injections, magnesium sulfate injections, levetiracetam injections, gabapentin tablets, diazepam injections, and tablets. It is imperative that the counties draw these commodities from KEMSA to ensure consistent supply to the deserving patients. With regards to which pharmaceutical manufacturers, suppliers, and distributors are partnering with the Ministry of Health and KEMSA to ensure availability of these medicines, Honorable Speaker, honorable members, the KEMSA aligns its procurement of health products to the Public Procurement and Asset Disposal Act, the Kenya Essential Medicine List 2023, Kenya Essential Medical Supplies List 2023, and the Kenya Essential Diagnostic List 2023. There are 42 registered local pharmaceuticals or medicine manufacturers at various levels of good manufacturing practice compliance. To enhance local manufacturing of medicines in the country, the Ministry of Health in 2024 conducted a capacity assessment of the manufacturers, and the report of this assessment forms the basis of the development of a local manufacturing strategy for Kenya that seeks to incentivize innovation and production of health products. This will lead to an increase in local production of medicine in KEML 2023 from the current 20% to 50% by 2026. Again, all public procurement entities, including KEMSA, are expected to comply to the Preferential Procurement Master Rule List published by the Ministry of Investment, Trade and Industry that lists all products manufactured locally, including medicines. The capacity assessment report guided the updating of the Preferential Procurement Master Rule number 1 of 2024 to the current 223 medicines. Public procurement entities are expected to procure locally manufactured products from local manufacturers in order to promote Buy Kenya, Build Kenya strategy in support of local industries and the domestic economy. KEMSA does pooled procurement on behalf of all public health facilities, thereby maximizing economies of scale to yield better prices for its clients. However, KEMSA have had operational challenges, including stockouts of essential health products and technology due to financial constraints as a result of inadequate budgetary allocation and huge debts from county governments and other clients up to the tune of 6.2 billion. With regards to what steps the Ministry of Health has undertaken to ensure the life-saving medicines are included in the essential medical list and made ready available under the existing Public National Health Insurance Scheme, Honorable Speaker, honorable members, life-saving medicines are listed in the current Kenya Essential Medicine List 2023 edition, which is reviewed every 3 years and are captured under various therapeutic categories, including medicines of pain, anticonvulsants, medicines for anxiety disorder, medicines for mood disorders, among others. Further, the Social Health Authority aims to provide affordable, accessible, and quality healthcare services to Kenya as guided by the Essential Health Benefit Package that defines the services covered by the Social Health Insurance Scheme. SHA will use the Essential Medicines List to guide the reimbursement of health services and health products to health facilities for various conditions, including those provided for people living with disability. It's a bit. Thank you.
Thank you, Madam. CS. Senator Kadri Muma, do you have any supplementary question to the response? You have an opportunity to ask 2 supplementary questions.
Thank you, Honorable Speaker. I have 2 supplementary questions. Thank you, CS, for the questions. Although the answer was not brought prior, so I was not able to read through, but I appreciate what you have just presented. My 2 supplementary questions are as follows. Does the Ministry of Health have a policy that provides relief for persons with disabilities or families with persons with disabilities to ensure that those who require the life-sustaining medication are able to access those medications for free. My second question, what is the ministry planning to do to ensure that KEMSA is reorganized to be the inter-county authority that it should be, rather than a national government authority, because KEMSA actually provides services to the counties? Thank you very much.
Madam CS.
Thank you very much, Senator, for the questions and concerns. Indeed, we have a health insurance subsidy for people living with disability. And again, working together with the social protection under the social, the people with severe disability are incorporated and are being paid for under the Social Health Authority. That way, they will not incur any cost. The government will take care of them in matters in matters health insurance. Additionally, we ensure that the medicines are again cost effective, and we are having cancer reforms ongoing to ensure that we promote inter-county engagement between KEMSA and the county. Thank you.
Next, if she has responded to the two questions, supplementary questions, or one?
Honorable Speaker, I'm not too sure that she has responded to the second one, reorganization of KEMSA.
But also, Senator Catherine, you know, your question was not related now to the KEMSA issues, but was on these drugs for the PWDs. Because standing on the 51C7 is giving us very clear guidance that two supplementary questions that relate to that question. Because, and also I'm speaking out to all the, obviously, Madam CS, I'm now speaking to all the senators in the House. I know how there are so many questions that you would wish to ask. But then these questions should be grounded on this, the principal question that Honorable Kadri Muma asked. So maybe, because it is your question, let me give you that opportunity. But next, I will not entertain any questions outside the primary question, so that we can make progress. And also, there are many questions, three other questions, which maybe if you wait, the issues you are listing now still can be dispensed of during the other questions that we have, because the CS has three more questions to attend to. Madam CS, on the reorganization of KEMSA to fit the county issues and remove it as a national entity. That's the question she had asked.
Honorable Speaker, Honorable Member, I kindly request for us to have a comprehensive report from KEMSA detailing what policies and reforms are there to ensure that we have this inter-county partnership. So I kindly request to go back with my team. That way we can have a comprehensive report on the same.
Okay. That's okay, but kindly remember to bring the report as you have committed to do. Next is Senator David Wakoli Wafula.
Thank you, Honorable Speaker. Question number 014.
It's whether you have a supplementary
No.
question to this question.
No.
Okay.
I
Your
think
time is coming.
she has
Senator
answered what
Manzo
we
Daniel.
want.
Thank you, Mr. Speaker. Mr. Speaker, I would like to ask, in relation to the question asked by Honorable Muma, and I want to state that I have confidence with the CS because she's a medical doctor on this particular issue. What efforts have you made to educate the public on such people who get seizures? Because the moment somebody gets a seizure, Kenyans tend to run away from them. And in relation to the counties, have you worked with the health promoters or a policy so that health promoters could also teach common Kenyans how to give first aid in case of a seizure? And probably you could use this forum to educate the Senate and Kenyans on what should happen should you get a seizure. You see somebody fall down, what is the immediate thing you should do to save that life? Thank you, Mr. Speaker.
Madam CS.
Thank you very much, Honorable Speaker, honorable members. Yes, indeed, seizures is one of the areas that is facing a lot of challenges for patients with the discrimination and alienation of the same. And so as a ministry, we are really working towards ensuring that patients receive, fast management, part of it being through advocacy. We are also leveraging on our community health programs to ensure that we have guidelines and curriculums that are easy for them to utilize. Again, for the school health programs to ensure that these epilepsy and seizures are equally able to be managed before they are referred to the facility. So we are having policies. Yes, we have policies, we have guidelines. We are leveraging on community health promoters. We are educating our healthcare workers on the same so that we improve the management and reduce discrimination of the same. Thank you.
Senator Waheti Duati, Veronica.
Honorable Speaker, my question would fall under, my supplementary question would fall under question 10 by Senator Enoch Wambua.
Okay.
So I'll not push it now. I'll wait for the that moment.
Next, Senator Olekina Redam.
Thank you, Mr. Speaker. Mr. Speaker, my question is directly related to the responses given by the Cabinet Secretary from the question asked by Senator Muma. Now, Cabinet Secretary, you've indicated that the biggest challenge is the debt owed by county governments, of about 6.2 billion to KEMSA. You've also indicated that SHA, which you know very well, that in the financial year 2024-2025 was allocated a total of 25 billion 798 827 666 shillings, which is up from the initial of 11 billion 899 413 839, which means there was an additional 13 billion allocated to SHA to be able to ensure that they provide this medicine to the people. If we are having problem, and I really would like you to pay attention to my question, if we have problems with drugs being administered in hospitals because county governments are not collecting the drugs, because they have not paid the money to KEMSA, don't you think that it is time as a ministry to develop a system where manufacturers, because the question you ask is about manufacturers, where drug manufacturers only release the drugs upon payment by SHA, so that these patients, and I speak this because when I was young, I was diagnosed with petit mal epilepsy. So I know the dangers of people who end up having epilepsy. So my question is, don't you think that it is time that you develop a robust system that can ensure that all those manufacturers list their drugs and only draw them down upon being paid, so that you don't have to incur all these debt? And I'll give you a very good example. It is like a supermarket. If you walk into a supermarket, you'll buy sugar. That supermarket does not own that sugar. That sugar has been placed there by a manufacturer. So the only time that it is released, it is when he's paid. We have SHA, 25 billion. And then you also have counties collecting money from ONSO's revenue to use. This House has passed a law. So can you please tell us how we solve that problem once and for all? It is not right for people who are sick, people who are epileptic, disabled people who are epileptic, to stay without drugs in their hospitals because county governments have not paid KEMSA for the drugs that they're collecting. Please answer that question diligently, and if you've not understood it, ask me again and I'll explain it. Thank you, Mr. Speaker.
Madam CS.
Thank you once again, Honorable Chair and Honorable Member. So indeed, drug availability is really critical for us. We have one of the key challenges that we have faced as a ministry is ensuring that the drugs reach the last mile and ensuring that we have accessibility to essential medicines. And under the UHC, that is the Taifa Care, we are really working tirelessly to ensure that, first of all, we have recapitalization of medicines in KEMSA, and again, that they are reaching the last mile, that is to the facilities up to level 2 and 3 for accessibility by patients. Now, what we have talked about and we are really ensuring that we implement is that SHA will pay, the counties will, SHA will, after the counties have requested, what will happen is SHA will pay directly for medicines before the money is released to counties. That is, when they receive the money from from the claims, part of the areas, apart from ensuring that they are paying the claims, they will ensure that medicines are also withdrawn from that money, and that way before the money is released to the county. So it is an area that we are looking into together with SHA to ensure that we are paying up for the medicines before the rest of the money is released. And that way we want to ensure that KEMSA is routinely recapitalized, it has resources, it has essential medicines to be able to supply at county level. I don't know if I've made sense.
Senator Redamo.
Mr. Speaker, I'm not sure the Cabinet Secretary understood my question. Because now you are saying that SHA will pay KEMSA before KEMSA releases the drugs to the hospitals. The question is, and I want to be clear, and I'm happy to come and sit down with you and try to explain better what I mean. The question is, since we are having a problem with counties paying KEMSA for the drugs, don't you think that it's about time to become a bit creative and develop a system that will ensure that these manufacturers place their drugs there, only release them when they are being prescribed to a patient? That will solve two problems. Problem number one, pending bills. Problem number two, expiry of drugs, such that they don't have to be, they will only spend drugs which can be used. Because every day we are told what manufacturers are doing, including others making drugs to confuse people. That is my question, because what you are now saying is that you will develop a system where SHA is paid money before before KEMSA releases them? That's a bit confusing.
If you sit down, because you are not exchanging with the Honorable Senator, when seated, you can benefit from your officers.
Yes.
You can benefit from them.
So, Mr. Speaker, I think I've made it very clear. But now I'll allow my colleagues to maybe piggyback on my question.
Your colleagues, it isn't any senator with a supplementary question. You can't give your colleagues that opportunity to do that. But I think she has now understood your issue. No, let her first answer. I want her to convince first Senator Ndama, then you can ask your. And I give you also an opportunity, remember? You ask your supplementary question. Okay. I'll come to your rescue at some point. And honorable senators, you know, sometimes the CS cannot answer all the questions often. And I think you gave a good proposal that you'll be going back with your team to consult and bring a report on KEMSA reforms. That is part of the reforms that KEMSA should be doing, and yourselves, of course. But I know she's here to answer, but you know, as a chair, I should also be able to guide the House. Yes. That is why we have a chair, to guide.
Thank you very much, and we really we appreciate the innovative ideas that you are coming up with, and as I said, we want to work in collaboration and in partnership with the Senate to ensure that we are having medicines at KEMSA and also right down to facility level. So we acknowledge this, and we take your concerns seriously and look towards engaging. We'll be having a comprehensive discussion and a report on the health products and technology to ensure that they are reaching the last mile. So again, as I had said, once the county has launched a claim from a patient, what will happen is that SHA will pay to KEMSA directly with regards to the medications. Yeah? For each claim, SHA will pay directly to KEMSA. That way the resources will be there, and that way the medications will be there, and the cycle continues. However, we acknowledge that there are other innovative interventions that we can ensure, and we appreciate, Senator, for the interventions that you have placed in front of us. So we will have maybe engagements on the side to see how we can extensively improve you know, the commodities reaching the last mile. And additionally, we will have a comprehensive report on how we are having our health products to be there at county level, and especially at our facilities.
So, honorable senators, on this issue, I want to guide that on KEMSA issues, I hope you are still the chair for health, isn't it? Or there is some guidance I wanted to give through the committee of this House on health. So what I want to guide is on these KEMSA issues, the committee on health of this Senate to follow up with the CS, Senator Ndamolekina, the ministry will be very happy to benefit from innovative ideas that you have. So anytime you can approach even the ministry, sit down with the team, and also offer solutions to this country. I'm happy that we are giving solutions, and that is the way to go. Because we always complain and say things are not working. Then how do we make them happen? As leadership, as leaders, I'm happy that now we are giving solutions. So the Senate, through the Committee on Health, should be able to follow up on that report on reforms to do with the KEMSA, because that is where the problem is. And Senator Ndama, I think you are a member of the Health Committee? Yes, definitely. Now you have that opportunity to really team up the committee, the entire committee, so that you can be able to really discuss these issues and bring the report to this House. But I want to give the Senator Mandago, what is it that you really want to say? Because Honorable Senator, let us go to other questions, so that also we can get that opportunity to interact with the CS.
Thank you very much, Honorable Speaker. My supplementary mine is a question to the CS. Whereas counties owe KEMSA, but also national government through Ministry of Health owes KEMSA. Why are you not releasing, if you have been given 25 billion in the budget, why are you not paying your bills also to KEMSA and you are the ministry responsible for KEMSA. So you cannot be shooting yourself on the foot, saying that counties are not paying while the ministry are doing. What are you doing as a ministry to pay also your obligation? And finally, Honorable Speaker,
One question, please.
as a chair, just allow me only 1 second.
Chair, you have all the time with the ministry, of
They don't
course.
honor our summons. When this ministry has a lot of contempt for the Committee of Health of the Senate. That is it. But it is okay. If that one question is sufficient, we shall sit down. Thank you.
You know you have that under very sensitive matter when the CS is here. What did you say? What is it you want this house to help you to do?
Honorable Speaker.
Because you are the one I'm tasking to follow up these KEMSA issues. And then you are still again.
Yes, but we are also telling you as it is. Honorable Speaker, sorry, Honorable Speaker, allow me to say this. Health is about 90% involved. But the involvement of the ministry in the Committee of Health of the Senate is 10% of the involvement. They have a preferential treatment of working with National Assembly as opposed to working with the Senate. Honorable Speaker, you are aware we had our midterm review of the Senate activities for the last session. We have only 2 years as a committee to help this government to make sure that UHC is properly rolled out, benefits Kenyans. Did you see any of the Minister of Health officials in Naivasha when we had our review as a whole Senate, not as a Committee of Health? So, Honorable Speaker, when we say as a committee we are frustrated, the majority leader knows. I had even asked him to stay away from chairing the Senate Health Committee because I don't want to be associated with failing. When we have a whole committee that is willing, they are committed, they have innovative ideas. You have heard what Senator Ledama said. And we are willing to make our contribution and our ideas and innovation on how we can make these things work. Honorable Speaker, you know I'm a governor emeritus. I've also run health for 10 years. The ministry can benefit from my experience as a governor on how we can handle issues of pending bills in the county. But where is the opportunity to have this discussion?
Senator Mandago, those are very valid concerns. And as a chair, it's really not, it does not sit very well when the CSU are here and the chairman of health is complaining that he's not able. And the whole team, you can understand and appreciate the ideas coming from the Senate. Yeah? And our concern is really on devolution to work. And that is our core constitutional mandate. So if the chairman of health is here complaining, lamenting that between you and them there is a disconnect, and you see from the chair I'm giving guidance on what should be done on KEMSA, the reports and all these things. Does it even also the directives that I'm giving will not be implemented? So I think give your commitment that you will really work with the Committee of Health of the Senate. Give that commitment while you are here today.
Yes, Honorable Speaker and honorable members, we want to inform you we acknowledge and we really send our apologies for that. For the 3 that we have been summoned, we've been able to go for 2 meetings, which were quite fruitful, and we were able to pick some very critical concerns that we addressed and some very innovative ideas that we were able to implement. And so we really, really, as I said earlier on, appreciate the work of the Senate, and we want to really collaborate together to ensure that Taifa Care becomes a success. So out of the 3 we attended to, we missed 1. That was because of our cabinet meeting, and I shared I shared the same with the Senator Mandago. But moving forward, we want to assure you that we'll be working collaboratively. Indeed, health is devolved, and these are critical things that we need to look into to ensure that we have successful implementation of Taifa Care. So we apologize, and we assure you that you will not see another incident like this.
on the mid-term review of the Senate work, you went there afternoon scheduled for you during that retreat, and still you have not presented your paper to us. Maybe you must get your time to engage the Senate. You come on a free Kamkunji and engage the Senate, either through here or any other place, so that also you can present your issues, and also senators will be able now to interact with you and also help your ministry to serve Kenyans better, especially to make sure that our hospitals in the counties get the necessary attention that they need. So another commitment, find your time through the majority leader is here, through the clerk of the Senate, so that you can also get your time to present the issues that you are to present in Naivasha 2 weeks ago. Let's go to the next question. Senators will get an opportunity still now to interact with your question. All these health issues are just the same. If you listen to the Senator Wambua's question or questions, they are interrelated with the issues that you are raising on this floor. Therefore, so, Senator Manzo, what did you say initially?
Do it in one sentence. So, Mr. Speaker, I was just simply asking, if Senator Oladamba gets a seizure and I'm seated next to him, what will I do? And this for benefit of you and the rest of the community, as a medical doctor. I mean, a lot of people get seizures, people run away from them.
When I was in school, we used to have, you can put a spoon so that it doesn't cut the tongue. But the CS, you can advise Senator Manzo what to do when he gets somebody with a seizure. What should he do?
Thank you. So we have our ABCs of resuscitation. We have guidelines and curriculum for first aid management, again for resuscitation of cases. And again, we have various bodies that support in training on the same. And so as a ministry, we have placed the curriculum and guidelines for first aid, including management of seizures. And I believe that moving forward, we'll be able to strengthen that and improve our monitoring and evaluation to ensure that all Kenyans are informed on how to conduct first aid for patients with seizures.
Senator Manzo, when those sensitization dates are given, you must avail yourself for that training. So let's go to the second question by Senator for Kitui County, Enoch Wambua. Senators, you know, it is where I sit, there are so many things we do, consultations. Senator Amina Kibwana, I know you have a question and you'll be able to ask. No problem.
I thank you, Mr. Speaker. Mr. Speaker, I see my brother, Senator Akoli, in a deep conversation with the CS, which is a good thing. I'm sure he is briefing out on a few things. Mr. Speaker, I will ask question number 10. But Mr. Speaker, before I do that, because my gadget was on for a long time, to raise an issue or two on previous questions. I will raise them, and the CS does not need to respond. I will just raise them, and I will continue with my question. The Speaker, one of the issues that I wanted to raise was the issue that was raised by Senator Olekina. Clearly, Mr. Speaker, we have a problem. And you know, Mr. Speaker, one of my biggest weaknesses is to say things as they are. We have a big problem. One of the biggest problems that we have is when people want to answer their own questions. You know, I ask a question, but you want to answer your own question. The Speaker, the Dama asked a very leading question that would really have helped us as a country in terms of management of healthcare.
Senator Ombo, I gave very clear guidance on the matter.
Mr. Speaker, please hear us out, Mr. Speaker. Just listen to senators. Mr. Speaker, this is a house of debate. If you want to put us in a straitjacket, we will not fit there.
This is now not a debate time. Of course, you know, you have a question that we're supposed to answer.
Yes, Mr. Speaker, and I say that I had raised a point
And
that
I praise
we
that
did not,
matter on the committee on health. Why should we go back to
I don't
that-
see
the
that
same
committee,
matter?
Mr. Speaker. Just allow me, if you will. Mr. Speaker, there are different ways of managing healthcare, not just in Kenya, but across the country, across the globe. You could lease equipment, you could do direct procurement, you could do managed equipment scheme, and Senator Ledama brought up a very important issue of placement. And that's where we get help, Mr. Speaker. Where manufacturers could actually place medication in hospitals are released to patients on prescription and paid for upon use. So that when the drugs are expiring, the manufacturers bear the responsibility of withdrawing their own drugs, and the hospitals do not suffer over expiry. Mr. Speaker, I'll go to my question because I see a level of impatience on your part on this matter. Mr. Speaker, I want to ask the Cabinet Secretary for Health. Question number one. How much money in terms of contributions was in the accounts of the National Health Insurance Fund at the time of transition to the Social Health Insurance Fund, SHIF? And could the Cabinet Secretary state the banks and bank accounts in which the money was held? Question number two. Has the money been fully transferred to the Social Health Authority accounts? And if so, could the Cabinet Secretary state the banks and bank accounts into which this money has now been deposited? Question number three. How much money has been collected from contributors since the advent of SHIF? And could the Cabinet Secretary state how much has been utilized for the benefit of contributors, their beneficiaries, and other eligible Kenyans? The last question, number four. What measures are in place to ensure that the money is not misappropriated and the contributors, their beneficiaries, and all Kenyans are not denied access to health care?
Madam CS.
Honorable Speaker, honorable members, the Social Health Insurance Act number 6 of 2023 came into effect on the 22nd day of November 2023, hereby repealing the NHIF Act number 28 of 1998. As at 30th September 2024, NHIF bank accounts held a total of 1.4 billion, as tabulated on the table below. Honorable Speaker, honorable members, with regards to the transfer to the Social Health Authority account, the commencement of the Social Health Insurance Act marked the beginning of the transition period from NHIF to Social Health Authority for a period of 1 year, as stipulated by the Social Health Insurance Act. And during the 1 year transition period, NHIF continued to receive contributions and offered services on behalf of the Social Health Authority as per the NHIF Act up until 30th September 2024. On 1st October 2024, SHA took over the operation of NHIF. However, all the pending claims are still being processed and paid under NHIF. The monies in the NHIF bank accounts are being used to pay for pending claims and other payments incurred by NHIF. The fund paid NHIF claims as shown as in the table below, totaling to 8.6 billion. There is claims payable amounting to 24 billion as of 25th February 2025 for hospital claims, Linda Mama, capitation, and group life. The balances in the NHIF bank accounts are as follows, totaling to 11.2 billion. million. The management froze all the NHIF collections accounts in the month of November 2024 to ensure seamless transition of collection to the SHIF accounts. And SHA is now in the process of closing the accounts except for one that management has resolved to maintain for collection of NHIF late contributions from employers and government institutions paying NHIF debt, such as civil servant medical scheme arrears, as well as receiving penalties from employers. Regarding Part C of the question, Honorable Speaker and Honorable Members, SHIF was rolled out on 1st October 2024 to receive contributions and provide medical services as per the SHI Act. SHA management opened bank accounts as per the approved list by the board and the National Treasury, and the table, as you can see, shows the breakdown of contributions received under Social Health Insurance Fund as of 31st January 2025, which is 20.9 billion, and you can see the breakdown from the table below. Regarding the claims, the total claims paid to date are 18.2 billion, out of which 16.9 relates to Social Health Insurance Fund claims, and 1.3 relates to the primary health care capitation, and is also shown in the next table. The measures that are in place to ensure that the money is not misappropriated and the contributors, their beneficiary, and all Kenyans are not denied access to health care. Honorable Speaker, honorable members, the management has instituted proper internal controls to safeguard members' contributions by ensuring, first of all, that the development and implementation of a new system for the purposes of SHA is operational. Secondly, the opening of designated bank accounts for handling Social Health Insurance Fund, primary health care, and emergency chronic critical illness funds, as well as SHA operations. Thirdly, the implementation of Section 42 of SHI Act that restricts SHA administration expenses at 5% of the collection. And fourthly, implementation of a standard benefit package and tariffs, thereby removing subjectivity in payments while ensuring predictability. Again, data cleaning through fresh registration to generate accuracy of beneficiary data has been done and is ongoing. The PHC and ECCIF, that is the primary health care and emergency chronic critical illness funds, are exchequer funded and thereby accessed upon registration, while the Social Health Insurance Fund benefits are available upon payment of the 2.75% premium. The fund, under the first schedule of the Social Health Insurance Act, Transitional Provision 5.1, which states that the fund shall not provide enhanced benefit schemes and packages, insulates against the losses of the enhanced schemes.
Senator Enoch Kwambua, you have the opportunity to seek for more clarification as in supplementary question. And Honorable Senators, this response has a lot of figures and tables, so I hope you have the response with you if you want to properly interact with the response from the CS. I have copies here. If you don't have the copies, you can still get more from the table. Senator Wambua.
Mr. Speaker, I will skip the tables and the figures because I've just seen them now. And because you have said there will be engagements going into the future, then perhaps you can transact that business elsewhere. I will go straight to my two supplementary questions. Madam CS, my appreciation of SHA and SHIF as a Kenyan, now not even as a Kenyan, is that what your ministry is doing is trying to climb a tree from the top. That's my honest response to SHA and SHIF. Why? Because under universal healthcare, and this is not a Kenyan program, it's a global universal concept, supposed to facilitate access to affordable, promotive, preventive, curative, rehabilitative, and palliative care to patients when they need it. And for that to happen, two things are important. One, infrastructure development in terms of just physical facilities and equipment within those facilities. That's infrastructure. And the second one is personnel. You know, doctors, nurses, clinicians, support staff, to make sure then that forms the basis of rolling out UHC. Madam CS, what don't you tell us and tell this country, of those two important facets of the success of UHC, what did the government do before rolling out SHA to ensure that we have, one, enough facilities, infrastructure, and two, we have sufficient personnel to deal with the demands that come with UHC? Secondly, my second supplementary question is a live matter. You and I and Kenyans are aware that private and faith-based health facilities are withdrawing from the SHA for reasons of funding, release of funds to the facilities. I saw yesterday the CEO make a very irresponsible statement saying that there are only 300 facilities, so even if they disappear, nothing will really change. Madam CS, you and I know, Kenyans know, that those only 300 facilities could be the only facilities available to Kenyans, especially in far-to-reach areas. So the withdrawal of services by those facilities is actually a death sentence to millions of Kenyans. That statement coming from your CEO, Madam CS, I would have expected a rejoinder from you immediately to say that you care, if you do. Madam Speaker, Madam CS, what are you doing to win the confidence of the faith-based and private health facilities to make sure they come back on board and continue to offer services to Kenyans, especially to far-to-reach areas? I thank you, Mr. Speaker.
Okay, Madam CS, answer the two supplementary questions.
Thank you very much, Honorable Speaker and Senator Wambua. Affordable, accessible, quality care is indeed critical. This universal health coverage, and in our country, Taifa Care, has been implemented. It's part of the Sustainable Development Goal. It's part of Africa Union 2063. We've had multiple guidelines from various bodies, including the World Health Organization, and in terms of implementation of universal health coverage. And so this is not something that the ministry just sat behind the bench and looked into. What we reviewed is data, publications, research, and other implementations, best practices from various countries, including Thailand, on how they were able to make UHC a success in their country. And so for us, it's indeed critical, because even as you look in various countries, you observe that they raise concerns and grievances, first of all, on waiting time, second, on the system interruptions. So this is a common issue. But one thing that cuts across board when it comes to UHC implementation, what all the countries that have implemented talk about is that it is better than nothing, because they know that if each and every one of them can access services, then the country will move forward, and we will not have a catastrophic expenditure when it comes to health service delivery for our people. And so, indeed, it is critical for us to really embrace UHC as a country and ensure that we are all in the same page. And that's why, again, we really emphasize on collaboration even with the Senate and among other stakeholders to ensure that it is a success. And so we take note of the infrastructure and equipment, and you'll notice that part of our pillar is the health products and technology within the pillars of of UHC. And in this, we have the NEST project, the National Equipment Service Product, where we've had multiple counties sign the agreement. And again, that is around 45 out of the 47 who have signed the agreement, and 36, again, who have listed down the equipments that they need within the facilities. And so it is an area that we look into. Now, you will also observe that within our country, what we are seeing is we are building shells, we are building structures, infrastructure, but we don't have the services needed. We don't have human resource, we don't have health products. So again, we really need to balance, and that's why as a ministry, we went back and reviewed what is critical to ensure that human resources are there, to ensure that health products are there for the patients to see. Those are really the critical components that we are looking into. And that's why we really need some time to look at the comprehensive report and see how we are working together with KEMSA to ensure that there's recapitalization and ensure that medicines are reaching, or the commodities are reaching to the last mile, because that has been a challenge. And especially in level 2 and 3, the dispensaries and health centers, where you observe that there is no medicine, and now people are moving towards the higher levels of care where they say their equipments and health products. And again, that brings a lot of challenges, because now they become congested and they cannot run fully. But when we have our health centers and our health centers, and we have our dispensaries, having human resource, having medications, that way people can be able to access services, and that's why we really need your support even moving forward. And so with regards to health products, we will have a comprehensive report. For infrastructure and equipments, we have the National Equipment Service Program. And again, with regards to human resource for health, we are looking towards having more human resource for health within the program, and ensuring that they are running and supporting this initiative. So the personnel is not out of it. It's part of our action plan to ensure that the services continue. Again, we continue to support in the building of health centers as a country, and we continue again to ensure that they are functioning. You will notice even in our annual plan and our budget, we are supporting in the development of health centers, but really emphasizing that it is not just a shell, it's not just a building. What we need is the services, and for the services to be there, we need health products, we need human resource, again, in that platform. So the private and faith-based organization, we do take note. We are acknowledge that they are really a critical pillar in ensuring that health services are delivered to all Kenyans. And so we continue with our partnership with the private organizations, the faith-based organizations. We have had routine meetings with them to ensure that they are supporting in implementation of UHC. So what was critical with regards to the withdrawal of services was the NHIF debt. And so what we have done is, together with the Social Health Authority team, is having routine meetings to see how we can have a payment plan for their NHIF debt. We are engaging Treasury. We are engaging various MDs that were involved, for the bill, to ensure that there is payment of that. So our engagement is ongoing. But as you can see, first of all, is that we are paying them on time. While we had talked about 90 days, we are actually paying them within the 30 days. And when you engage them further, the problem is not Social Health Authority. We are ensuring that the payment is done within the time limits. The challenge was on the claims management, which has been addressed currently. And again, the challenge again that is really we are facing is the NHIF debt. So then once we have addressed that, I believe that we will be in a position to ensure that UHC is implemented. So NHIF debt was number one. Number two was the primary health care fund. which again they had not, some of them had not grasped the concept of the global funding. And so what we have done is that we are meeting them to explain to them and really tabulate what it means for them in matters of the new form of the primary healthcare funding model. And what you'll see, it's actually of benefit to them, because while previously in NHIF they were only covering around 7 to 8 million Kenyans, we are having universal. So we are having more Kenyans on board, so more services to Kenyans, and so more revenue collected in this. And so it's really explaining to them how the calculation is done for them to understand that they are not going to lose, they are getting more even through this system. And so we are reaching out to them to ensure that discussions are ongoing, and our partnership as the our partnership with the ministry and the private and faith-based organization continues, because we really need to have their services so that they can be accessible to all Kenyans. So we will honor the bill, we acknowledge, and we are having a payment plan for NHIF.
Next is Senator Seki Lenku. Are you not satisfied? You went two supplementary questions, which she has answered.
Thank you, Honorable Speaker.
Unless if you are not satisfied, then I'll give you an opportunity to get clarification.
Okay.
Senator Seki.
Mr. Speaker, I'm not satisfied with any of the responses that have been given. On the first one, Mr. Speaker, then the CS should just go on record. This is the Senate. This is the floor of the Senate. Just go on record and say that you are not ready for UHC. Because in so many words, that's what you're saying. You're saying you don't have infrastructure, you're saying you don't have personnel. Just go on record and say that as a country, we were not ready for the rollout of UHC. You cannot tell the sick nation that you are putting money to build hospitals, you're looking to recruit staff. That should have happened before you rolled out UHC. So just go on record, be clear on that. On the issue of the faith-based facilities, Mr. Speaker, what baffles a lot of us is that this is already realized revenue. It is not money that CSE, you listen to the questions, you may...
Senator Ambu, I think let's protect the CS. You know,
but now I'm asking her a question, she's talking. How is she listening?
Senator Ambu, I just have your cool. You know, I said, you know, this is like a team. I'm trying to see whether she can benefit from the other team, the PS and the Director for Medical Services. Maybe if she is consulting, then you can suppose.
Maybe then that's a guidance you should give us, Mr. Speaker, that we speak while looking at her, so that when we see her asking a question, then we stop.
Yeah, that's what
otherwise, who are we addressing?
Maybe you can pause and then you could now proceed.
Mr. Speaker, this is very interesting.
Supplementary question. So,
Mr. Speaker, let's just agree that this is a very important issue. This is not about even anyone. Mr. Speaker, on the issue of the private and faith-based facilities, the CS has said that there's a plan, you know. And I'm saying this is already realized revenue. It's not money that they are supposed to be going to look for and pay. It's realized revenue. The Speaker, as I sit down, what I want the CS, myself, and everyone in this house to realize is that we can speak in the comfort of this city because we have hundreds of facilities around us here. The Speaker, in real Kenya, in the marginalized areas of Kenya, the faith-based organizations and private institutions are a lifeline to all the people in those areas. When those facilities are not offering services, then there is no UHC that is taking place anywhere. Mr. Speaker, I want the CS to respond to real issues, not literature, Mr. Speaker. We are not talking about data, real issues. I expected her to tell us, Mr. Speaker, when we were closing down on NHIF to go to UHC, we had X number of facilities. At the time of rolling out, we had increased the number from X to X plus 1,000. We had X number of doctors. We increased the number from X to X plus 20,000. Those are the figures that are expected, not literature, Mr. Speaker. I thank you.
CS.
Thank you, Honorable Speaker, honorable members. So, yes, so UHC is a journey. Implementation of UHC is not a one-off, it is a journey. Right now, when you look at even countries like UK, which has been able to implement NHS,
Senator
challenges
Abua,
are
I hope you are
again,
listening to the response, because this is your response.
you observe that the challenges are still present. They talk about human resource for health, and you can see even for us as a country, we are having our nurses and some people going there. So it is a journey, and we have to start somewhere. And our priority was to ensure that all Kenyans are registered. That way they can be able to access services. And so this is a priority to us, registration. Additionally, health financing, ensuring that contributions are coming up. With regards to the benefit package, we are having an advisory team that is meeting routinely to ensure that the package meets the needs of Kenyans. And so what I really wanted to really highlight is for the human resource for health, again, it's a journey. Once we have our health financing, once our patients are being seen, once the products are reaching to the facility, then the resources continue to accrue, then we can have even more human resources coming in and again supporting us in the implementation of UHC. So we'll have a small proportion currently, but as we grow the UHC, as we improve accessibility to all Kenyans, and we have the facilities again accessible to all Kenyans, that way we'll be able to capacitate the country. And so I think it is critical that senators, even as we engage and have these innovative ideas, let us understand that the implementation of UHC will not be a one-off. It is indeed a journey. We have looked at best practices across, the globe, how they've been able to implement it within our limited resources. And our primary goal is to ensure that all Kenyans can access these very services that the rich or the employed are also accessing. And so for the faith-based organization, as I said, and the private institutions, this is a critical thing. We are talking to His Excellency the President. Again, we have talked to the Treasury, and now we are also requesting for your support, to ensure that we are paying the NHIF bill. So we are looking for the money to have a payment plan, and we will be paying the NHIF debt that is there so that our private institutions, our faith-based organizations can give the Kenyan people the services that they need. And this is really the critical thing that is being raised by the private and the faith-based.
Okay, Senator Seki.
Thank you very much, Honorable Speaker. Honorable Speaker, I think these are very important questions from Honorable Wambua. And I think the CS need really to understand that the entire country is listening to her. And she needs to give answers because people are waiting these answers. Honorable Speaker, I want to request that the CS, if she's aware that, and I think the same thing, when Mheshimiwa Mandago was raising a questions on the debts that the national government or KEMSA is another issue that has not been responded to. But nevertheless, I want to say, request the CS, if she's aware that civil servants are not getting treatment or denied treatment in private institutions, and now because it is because of the debts that the government owed, through NHIF and SHA, if she's aware. Again, this has also translated to the injured police officers who have been injured while on duty, that they have a lot of debts that is accruing in NHIF for insurance company not paying to the officers who have been injured while on duty. But the reason why I ask this question is if the CS understand that civil servants, police, teachers, and all civil servants are not getting treatment in private institutions because of the debts that are accruing, that has been there in NHIF, and you've shown how the figures has been given or has been transferred, and that transition is really bringing a lot of problems. So, Honorable Speaker, I want the CS to answer that question. Thank you.
Actually, that question is just related to what Senator Ambua was trying to pursue. So when the CS is responding to the senators, kindly, you should be very keen so that we can understand. Otherwise, we will stay with the same question, the same answer, the whole morning. But do you have a different answer? Madam CS? Yes? On civil servants?
We don't have another answer. That is the same. We acknowledge the greatest concern is the NHIF debt. And we acknowledge that. And we as a ministry are looking to see how we can ensure that the debt is paid. So we acknowledge that, and we are reviewing to ensure that we are paying the debt. Yeah.
Senator Agnes Kavindu.
Thank you, Mr. Speaker. My question is also related to those ones, but on a different direction of human resource, as in the doctors. Most of our people go to hospitals in the dispensaries and level 2s and level 3s, where the people are working there cannot minister high blood pressure medication or those kinds of medications. So they are forced to go to level 4 hospitals or level 5, and they are not able to go there. What are you going to do about those dispensaries and level 2s so that we can have at least a doctor there who can tend to the old people in the villages who go to such hospitals for attention? Thank you.
Yes, yes.
Thank you for the question. So we have our blood pressure modification medicines in level 3 onwards. Yes, we acknowledge that we don't have sufficient doctors in level 2 facilities, but we are working together with counties. Again, we've had best practices like rotations within these levels of care, the lower levels of care among the medical officers. And so, yes, we acknowledge, and we will have the blood pressure medications are from level 3. Yes, thank you.
Senator Veronica Maina.
Honorable CS, welcome to Senate, and we are wishing you a good tenure during your term of service at the Ministry of Health. CS, you have stated that, and aptly stated that SHA aims to provide affordable, accessible, and quality healthcare services to Kenyans, which is ideally the main objective of SHA. As a matter of interest, RUFA had threatened to suspend provision of healthcare services to patients, and we would like to know whether that threat was effected yesterday. I hope it was not. And we would want to know how the ministry has structured the claim of the 30 billion that Rufa is claiming. Have you arrived at any conclusion or negotiation or any mediation process that could have settled that claim, which was incurred by the now defunct NHIF and which is being demanded from SHA? What measures have you taken to ensure services are not suspended for the ordinary Kenyan?
I want to guide in this manner, because these questions are almost similar. I want to get like 3 or 4 questions, and then she can answer them, because they are almost similar, these questions. In the process, what clarification? And she has even not answered you. I don't give the mic, of course.
Thank you, Mr. Speaker. Mr. Speaker, the CS has told me that the high blood pressure and diabetes medication is in level 3. How will the people in the village know that that medication is in level 3? What are you doing in cooperation with the counties to make sure that the people know where they should be going? Because they go to the dispensaries, they go to level 2, and they are told we don't minister those kind of medications. Can there be a way of reaching out to Mwananchi to know where they should go for diabetes and high blood pressure and arthritis, because those are the sicknesses that are down at the ground?
Next is Senator Morango. Do you want to respond? Do you have a supplementary question, or do you want to ask your question?
Asante sana mstahiki Speaker. Ningetaka kumuuliza waziri kama amesikia kilio cha walimu, masikitiko ya walimu na uchungu wa walimu ambao walikatwa zile fedha za SHA, lakini zikaenda kwa hazina kuu ya serikali na haikufikia zile hospitali ambazo wanafaa kwenda kutimbiwa. Na bado wako na kandarasi na bima zingine ambazo zinafaa pia kuwasaidia katika mambo ya matibabu. Kwa hivyo swali langu ni hilo, kwamba kama ashajua, na kama ashajua zile shida ziko na walimu, amefanya nini kuhakikisha kwamba amesuruhisha ili walimu waweze kupata huduma? Asante sana Mr. Speaker.
Answer those 2-3 questions. The question by Senator Veronica and Senator Morango, and the clarification sought by Senator Agnes Kavili.
Okay, so I will start.
And then I'll be going to the third question by Senator Aminda Kibwana.
I'll start with the blood pressure question. And so with regards to hypertension and other non-communicable diseases, really communicable and non-communicable diseases in Kenya, we have more than 106 community health providers, health promoters who have been onboarded on the ICHIS platform, and they have been able to register more than 8 million Kenyans out of the 12.5 million households. And they've been able to revisit 7.3 million households, and they've been able to screen 28.2, they've been able to screen patients for diabetes and hypertension in these areas. So we've been able to screen Kenyans, 340 of them who have been referred for diabetes, and 730,000 who have been referred who had hypertension. So the community health promoters are indeed a critical platform that we are utilizing within the community to educate on preventive, promotive healthcare, and then also to identify and refer these cases. Additionally, even for level 2, yes, we have human resource like the nurses there who are able to identify the patients who have hypertension and refer them to higher levels of care. And so we continue with training and capacity building, mentorship and supportive supervision for our CHPs and our healthcare workers to ensure that they are identifying. And indeed, they have been a critical pillar and a game changer in regards to identifying these conditions that were once affecting our people. So again, just to emphasize on the NHIF debt, we are acknowledging the debt is there, and we are again looking at the payment plan. And really, this is the main concern with the private and the faith-based organizations. So what we have requested is that they submit all pending claims for verification, and then payment will follow in suit. So maybe even to give you a background, there was a press release yesterday by the SHA team, and what you can see, there's a lot of effort going towards payment of the social health insurance fund. We've been able to pay 5.1 billion. Then the concern they have is not social health authority. It is indeed NHIF pending bill. For SHA, we've been able to pay most of the time within 30 days, and the ones that were not paid were maybe the claims of which they are reviewing, and quite a good proportion has been paid. We are also having transparency and visibility and really engaging them to ensure that this continues with regards to claims, where they are and how we are progressing forward. So instead of 90 days, we are actually paying within 30 days, and we are pushing for the acceptance of this. But for the NHIF, again, we acknowledge, and we are looking for the resolution process in this regards. Teachers, like any Kenyans, have been able to pay the premiums that are entitled, and so they are able to access the SHA benefits that have been given to them. Again, teachers through the TSC, they use their private medical insurance. This needs to be paid by the TSC. At times they mix SHA and TSC medical insurance. So this is a different scheme which needs to be paid by the TSC. It is not SHA. But with regards to SHA, after registering and after paying their contributions, they are able to access the services under SHA. And maybe also to emphasize, at times, the employers say they have paid, but they have not remitted. And so again, we are brought on board and told that we are not offering SHA services, yet the concern is on the employer side. So we are also emphasizing and negotiating and ensuring that the employers remit. That way we can improve the noise that is out there. Thank you.
Leader of the majority party.
Thank you, Mr. Speaker. Mr. Speaker, I dictated to us a question which has been clarified on those, what are they called, the pending bills, with specific reference to faith-based hospitals. And I wish to urge the Minister to perhaps separate between private facilities and faith-based hospitals, because I know for a fact that some of these private facilities, if you look at the debt burden, it is mostly heavy on the faith-based facilities for reasons that every Kenyan knows. That it is difficult for any faith-based institution to do some of the things that private facilities are able to do to get their payments faster. And perhaps that matter needs to be treated with more urgency, Mr. Speaker. However, because I've gotten the mic, I want to register my comments alongside that of the chair of the Health Committee, that I am terribly disappointed by the conduct of this ministry, led by the Health Minister, together with her two PSs. They have treated this House with serious contempt, and that is not something that I take lightly as Majority Leader in this House. The fact that they missed our midterm review meeting, Mr. Speaker. The Cabinet Minister says she was in Cabinet. What about her two PSs? Where was Harry? Where was PS Mudhoni? Couldn't they find their way to Naivasha? How can you continue to interact with colleagues whose only
interest with health matters is a budget allocation to your ministry. All policy-related matters are implemented at the county governments, Mr. Speaker. You can hear the kind of questions that senators are asking. Some of them is purely on account of the fact that this ministry has failed to interact with this House in the manner that it ought to be, Mr. Speaker. If there is a big failure, Cabinet Secretary, that I want you to register as you leave this House, forget about SHIF and SHA, much as those are very important issues, is the fact that you have not been able to lead your ministry to have a serious engagement with the Senate of the Republic of Kenya. And for that, I hold no other person responsible other than you, Madam Minister. And that is not something that is acceptable to us. Therefore, Mr. Speaker, I want to agree with your finding that when the minister returns to her office, can she find the time to come and provide an update on all the issues that he had been requested to come and present before a midterm review meeting, and ask for a time that we avail? This House is available on Tuesday mornings and Thursday mornings. Can she pick a day in the next 2 days if she wants to restore normal relations between us and the Ministry of Health, Mr. Speaker? Otherwise, I am terribly disappointed, Madam Minister. And P.S. Harry knows this. P.S. Mudhoni, you know this. You are my good friends, but you have let your boss down. You need to work better with a House. We passed those four laws, Mr. Speaker, knowing that SHA was going to be transformational and change the lives of Kenyans. Do not sit in your office, Madam Minister, and listen to your choir of office officials. Come and listen to the representatives of the people to tell you the challenges that people are facing. I rest my case, Mr. Speaker.
Now, Majority Leader, you know, I navigated that matter and I gave guidance. But since you represent the majority side, you have pushed a lot of business from the Ministry of Health. We did actually bills at night, at midnight in Turkana, I remember. So, Madam CS, that every voice coming from the majority leader, you should know things are not okay, yeah? Coming from the majority leader in the Senate. So you really need to organize yourself, reorganize your team, take time to listen to the legislators. You know the Senate is a house of reason. Things that you cannot be able to be told by other people, you can be told by the senators, because we really want, I say it again, devolution to work. Most of the health issues are involved. So most of the time spent with the senators because you know what is happening in the counties. Don't spend your time chasing for money in the budget of in the National Assembly. After you chase your money, then come back for policies from this House. You can see the West is almost more than that. The senators are here to listen to you and to dialogue with you. And as I put it, find your time. The time we are located in Naivasha, I repeat again, find your time to sit with the senators. There is a time you came to the National Assembly and you requested us to join you there. We had no time even to ask a question. There was absolutely no time. So what you did at the tent there was not enough. We have many questions. It's only that I'm chairing. Actually, I could have manned you with so many questions if I was sitting on my seat here. So, as I guided senators, let me get 3 more and then we move to the other question. Senator Koiti, Omtata.
Mr. Speaker, sir, thank you for this opportunity to address the Minister of Health.
A supplementary question, not
yes, I'm
to
asking a
address.
supplementary question by addressing her. My question is, Cabinet Secretary, conceptually speaking, how do you reconcile the concept universal health care and the practice of paying premiums? Paying premiums means that you have capacity. Universal means nobody's left behind. Paying premium means only those who are able can come on board. So how does it become universal health care when people have to pay premium to access the service? Because we are trying to invent the wheel in Kenya. There's absolutely no country in the world where universal health care is funded through premiums. It is usually funded by main taxes, and Kenya is a signatory to the Abuja Declaration of 2001. When did we move away from Abuja to SHA? That's the question I want you to answer after reconciling the conceptual, the philosophical contradiction that you are visiting upon this country by using stock phrases like universal health care. Thank you.
Senator Chalge.
Thank you, Mr. Speaker, sir, in answering. I think what the majority leader forgot is that the ministry has also left the president to be explaining the issues of SHA instead of them communicating the country even on a daily basis. So I hope you take those notes and take it seriously, that as a ministry you must come out and explain and answer questions so that we don't leave it to the president. So, Madam Minister, we can cut some slack because you just came in, but you must pull up your socks. Finally, Mr. Speaker, sir, there is this story, Madam Minister, can you put it to rest, about baby Ariana Wairimu? Allegations as that she had a bill of 1.6 million, but SHA only paid 23,000. What is the proportion in line of what Senator Wambua was asking in terms of payment in proportion of the bill that the hospital is using? So the case, you can use the case of baby Ariana Wairimu, where that 23,000 only was paid against 1.6 million bill, and confirm to the nation in the same line whether all funds under SHIF fund, critical care fund, and primary health care fund, are those three funds under SHA and SHIF, under Social Health Authority, functional at the moment, Madam Minister, and confirm to the country that whether these three type of funds are functional and Kenyans can access. If they are not functional, just be honest and tell us either one or two are functional. I thank you, Mr. Speaker, sir.
Senator Sifuna. And then, Honorable Senators, we must move to the next question, kindly. Senator Sifuna.
Honorable Speaker, it's not every day I stand up and say that the majority leader has spoken for me. But this is one of those days, and I've always suspected that the majority leader is a good man, because whenever we come to critical junctures where we have to close ranks and say, if something is working, it's working, if it's not working, it's not working, he has always done so. And that is the conversation we've been praying for in this country. Honorable Speaker, and Madam CS, you're present here. The president, I heard him yesterday saying he pays 50,000 Kenya shillings for SHA. I very painfully pay an average of 32,000 Kenya shillings every month to SHA. And I say painfully because Majority Leader, you will recall that when that bill was here, I proposed an amendment to cap that contribution at 5,000. Unfortunately, that time, when a Majority Leader, you are not as good as you are this morning. You allowed the you voted to defeat that amendment, Honorable Speaker. But I want to cut through the noise, because here in Nairobi, Honorable Speaker, you know they say, hatutaki mambo ya kizungu mingi. Now that the president told us that if we remove that capping, that if all of us pay according to our abilities, we will end the specter of harambes to raise money for healthcare in this country. Can the cabinet secretary standing here before the Senate today confirm to us that there is no family in this country that has planned a harambe for this weekend to get payment for a loved one to obtain healthcare, including that baby Ariana, Honorable Speaker? Can she confirm that to the country? And if she cannot confirm, then she should be gentle enough, she should be kind enough to tell us today that this thing is not working, that we should go back to the wisdom of Sifuna when we were having this conversation in this House. I thank you, Honorable Speaker.
Cabinet Secretary. Very well, Mr. Senator Methu.
Thank you very much, Speaker. In fact, I want to conceptualize the issue that has been raised by Senator Cherargei and Senator Sifuna, there's no way that the Minister and the Ministry of Health cannot say that they are not aware of the case of baby Ariana, who I would want to confirm, Honorable Speaker, is a patient from my own county, comes from Orjorok in Nyandarua County. Baby Ariana suffered from Pearson disorder, and she is the 10th patient in the world to get that particular disorder. So there's no way the ministry would say that they are not aware of such a patient who has such a rare disorder. And the hospitals in India have actually been using her case as a success of a Pearson's disorder that has been treated. It's a genetic disorder that has been treated. Honorable Speaker, unfortunately, we lost baby Ariana. Her bill, as it were, by the time she passed on, Honorable Speaker, was 1.6 million. What SHA has paid now is 23,000. And therefore, can't we use then this case to gauge whether SHA is working or not working? Because 23,000 out of 1.6 million is such a small and negligible percentage, Honorable Speaker. And you cannot keep reading statistics. This is what we have put as money. This is what the number of patients that have been taken care of. Give us on this very specific case that you must be aware of, because it's a very rare disorder. You must be very aware of baby Ariana. Tell us why SHA has paid 23,000. First, confirm whether SHA has paid 23,000. And secondly, tell us why SHA can pay 23,000 out of a bill of 1.6 million.
Very well, Cabinet Secretary.
Thank you very much. Honorable Speaker, honorable members. So I will start with the question from Senator Mtata regarding the UHC premiums. So previously under NHIF, as you remember, it was tax funded, but it was really capturing the formal sector with only 20% of the population under this health insurance. And so when we talk about leaving no one behind, NHIF was not living up to it because we were not able to cover each and every Kenyan when it comes to health service delivery. So when we come to SHA, we see that it is improved, where we are trying to ensure that all Kenyans are on board and all their health needs are addressed, and part of it is through using the social health financing, ensuring that 2.75% of their amount is again being deducted for contribution into the SHA, the social health insurance. Ultimately, our goal is to ensure that we are leaving no one behind. But equally, you take note that the indigents will be covered by government. That is the people who are unable or are not capacitated well to cover or to pay the premiums. We, as again, a government, we will be able to support again in their health insurance coverage. So I think this is really a great step from the 20% and then now ensuring that all are being covered. And you can see that we have now increased, registration is now up almost 3 times the population that was covered previously. So great progress when, Senator Sifuna, as you said, there's great progress when we talk about the number of people that have been registered and the number of people that can access primary health care. We are having, up to 3 times more that can be able to access. And then when we come to registration and being able to access services in higher levels of care, we are looking to ensure that there's improved contribution. Ultimately, all Kenyans will be able to access care. So I believe that this is a game changer where we will have Kenyans not selling their property in order to access health. Additionally, there are very good stories out there, and I can attest, and maybe we will, next time we can have a documentation and reports of, more than 500,000 being able to access these services, and again tabulate how much contribution that did they have to pay and how much was NHIF covering. That way we'll have evidence-based, and data-driven analysis to show you that indeed SHA is working. And when we talk about the issue of baby Ariana, yes, the ministry acknowledges, and indeed we send our condolences to the family. We send our condolences to the family. We acknowledge, again, that was a challenge. Seeing the Pearson's syndrome is really a very rare disease, and only 10 people in the whole entire world have this disease. And so as a ministry, we are looking into ways of ensuring that we are reviewing this condition, the diagnosis, the treatment, the management, etc. But when it comes to the management of the baby, when you notice that NHIF cover previously was 4,600 for ICU, but I can assure you that the ministry has really been advocating and pushing to ensure that our ECCIF, that's Emergency Chronic Critical Illness Fund, is improved. And right now, we are happy to say that after reviewing, it has been increased to 28,000 Kenya shillings, and that way gradually will improve. We have the benefits package advisory team, and this team will be reviewing the benefit package and seeing gradually how we can improve to ensure that Kenyans are accessing services. As you are well aware, at the beginning of UHC, what we looked into is the burden of disease in Kenya, and then we also looked at what was causing death and what was causing catastrophic expenditure, and also reviewing what NHIF was offering, and you can see the benefit is actually better or the same as NHIF. Nothing is lower than what NHIF was offering. But moving forward, based on the resources at hand, we hope to gradually improve the benefit package for the betterment of health services for all Kenyans.
Yes, Senator Methu.
Mr. Speaker, I don't know why the CS for health would want to take us in rounds. The question was very specific. Now that you admit that you are aware of the case of baby Ariana Wairimu from Nyandarua, who succumbed to Pearson's syndrome, the question was very specific. Is it true that SHA paid 26,600 out of a bill of 23,000, and 620 out of a bill of 1.6 million? That was a very straightforward question. First, tell us whether that is actually a fact that SHA paid 23,000. Then we shall get to the second limb of the question. Why would you say that then SHA is working if it has paid such a negligible amount of money out of a bill of 1.6? And maybe, Mr. Speaker, finally, because I have been following and I've been very, very, the parents of these particular kids are my friends. I know that, I know Lewis, the father to the girl. The family and his friends have on their own, out of their own contributions, spent more than 10 million to take that baby to India. And the government had not paid anything. So the only one last time that baby Ariana wanted SHA, the one that has been praised that is very working, the only one time that she wanted SHA to work is when she has succumbed, because out of the many bills that we have had, she was being treated in India. There was no way the government of Kenya would have helped her when she was being treated in India. So, Madam CS, tell us, is it true that SHA paid 23,000 for baby Ariana Wairimu out of a bill of 1.6 million? Don't tell us stories that SHA worked where, SHA worked where. This is a specific case, and you say that you are aware of it.
Yes, Gerard Gay.
I think, Madam Minister, through the Speaker, you know, this is a premium platform. What we are seeing in social media, you should put it to rest before where you're having a forum. We are asking a simple question. Baby Ariana Wairimu had a bill of 1.6 million. There is allegation that 23,000 has been paid. You have all officers around you. Why don't you consult so that, you know, we don't use social media hype to confirm that SHA is not working? And then finally, through you, Mr. Speaker, sir, Madam Minister, just be specific. Are these funds under Social Health Authority working? Because in your answer, you have only said about the claims of SHIF, and you have said nothing about the other two. Can you just confirm before the nation? If you do not have the answer at the moment, just ask for more time so that you can bring. Because as legislators, we don't want to join the rest of choir people who are saying SHA is not working. We want to protect your job.
Senator Mandago.
Thank you very much. Honorable Speaker, mine is just to inform the CS, just in case she's not aware, the CEO of SHA is actually seated somewhere in the gallery. Maybe with the help of the Sergeant at Arms, he can be ushered down to consult with the CS so that we can get an appropriate answer.
Senator Onyonka.
Mr. Speaker, first of all, I want to say thank you for giving me this opportunity. What I would want and I would pray for before I make my contribution. Mr. Speaker, the majority leader has pronounced himself. I believe that this discussion that we are having in this House is futile. It's an exercise in futility. Because the questions we have are close to 30. Like me, I've not even asked her who are the owners of the financial platform. You know, she's insisting that the SHA and SHIF are working. The reality is that everybody in our republic is talking about how that system doesn't work. In fact, I even want her to explain to me why NHIF was removed from providing the basic services. We knew that NHIF had issues of corruption and mismanagement in terms of the payments which were being, we knew all that. But you see, Mr. Speaker, what has happened is, I see the CS really struggling. Can I make a special request? Because I had the majority leader make a contribution, and indeed, the speaker who left before you came in did not pronounce himself what we need to do. I believe that this matter cannot be interrogated on the floor of the House. Maybe we need to have it in committee so that we can spend even a whole day to run through the figures, to ask those critical questions, because everything I hear here, Mr. Speaker, is like this whole exercise is just a confusion and a rearrangement of things which I don't even understand. And Mr. Speaker, I'm not very literate. I'm averagely somebody who's been to school. So can we, as a Senate, ask the CS so that she can go and prepare herself, so that she can bring we go through this with a tooth comb, so that once and for all, we may be able to decide, is it working or it's not? If it's not working, we go back to NHIF and fix it so that it continues working, because NHIF was doing better than what is happening right now. Thank you, Mr. Speaker.
Senator Hamida, and please be brief. We need to move to the next question.
Thank you, Mr. Speaker. For me, I will. In fact, I just want to remind Madam CS and even the PS, Harry, who was there, that I told you, make us your friends. We shall work with you. Convert us. I mean, have time with the Senate. In fact, I had even offered that we shall mobilize through my chair, Senator Mandago. We shall mobilize the senators only and have time with us to take us through, then we'll understand and we shall walk the talk. But unfortunately, that has not been done. Just a quick one, Madam Waziri. The standoff between the private and the government, the same SHA, I mean, looking at the digital claims right now, they're being processed in a way that they have been plagued with failures, Madam Waziri. Forcing providers to revert back to the manual system. And also you're talking about the success story and the success rate for patients' verification problems are still there, Madam Speaker. So kindly just address the standoff between the private hospital and the government hospital for the date of how you're planning to resolve the crisis. Thank you.
Senator John Nyotu.
Thank you, Mr. Speaker. I join my majority leader in saying that the Senate should be given equal recognition, if not more recognition, by the ministry, especially because health is devolved. I only hope and pray that that is not aimed at maybe preparing ground for laying off some people, Mr. Speaker. But coming to my question, especially regarding the baby from Nyandarua, I would like the CS to tell this House, Mr. Speaker, what SHA is doing for patients whose medication is not available locally, Mr. Speaker. And I say this because there are very many rare diseases. I don't know whether she knows about Gaucher's disease, which is a rare disease and whose treatment is not available locally, and where aid is given. Mr. Speaker, there are very many and high taxes paid, charged by the government from those donors. So what exactly is the position of rare diseases, especially those whose treatment is not available locally, and what is SHA doing about the same with specific reference to Gaucher's disease? Thank you, Mr. Speaker.
Finally, Senator Wambua.
Mr. Speaker, as a Senator, I'm grossly and completely underwhelmed by the responses from the CS. And I want to join my colleagues, Mr. Speaker, to request the House to direct that the Speaker, the CS, makes arrangements to appear before a committee of the whole House so they can engage on issues, especially on SHA and SHIF. Mr. Speaker, lastly, I don't know whether Senator Madago saw the right person. I don't know that person. I would actually feel insulted if the CEO of SHA was seated at the gallery when the CS is responding to questions about SHA on the floor. That goes, Mr. Speaker, to show the contempt with which this ministry treats this House. Mr. Speaker, if that is the case, then
Senator Wambua, would you like to be informed by Senator Wafula?
He can inform me later. After this, he can inform me. So, Mr. Speaker, if that's the case, then, Mr. Speaker, it's terrible. Really, this is very terrible. Mr. Speaker, let's arrange to have a meeting of the committee of the whole so that we engage with this CS. I thank you.
Very well, Senators. Very well, Wafula, I'll give you that opportunity.
Thank you, Honorable. Give me my mic. Thank you, Honorable Speaker, for this opportunity for me to inform my Honorable Senior Member that, Honorable Senator, not afford every staff to be seated here. So it is important that your message is at home, but the home is not at home. Thank you, Honorable Speaker.
Senators, give him the mic.
Don't run away from the response. You have informed me. The Speaker, choices have consequences. Choices have consequences. The CS must know who should sit next to her when she's responding to specific questions. You can never have a CS surrounded by other officials of the ministry when the CEO of the institution that we are questioning is seated in the gallery. Mr. Speaker, that is as simple as it gets. The chairs could have been occupied by first the CEO of SHA, and then the rest of the officials would have filled the rest of the SHA. I thank you for the information.
Thank you, Senators. We have to proceed. I'll give Cabinet Secretary an opportunity to respond to all the matters that were raised, and then we proceed to the next question.
Yes. With regards to baby Ariana, SHA has not received an invoice from Fortis Hospital, India. Upon receipt, SHA will review and make payments of what is allowed according to the benefit package. But I really thank you and acknowledge the things that have been discussed, and especially the way forward in regards
order,
to
Honorable Senators, order. You asked the questions, please pay attention to the answer. Senator Mandago, Senator Wafula, please let's listen to the CS in silence.
For us to meet the committee and engage possibly in a retreat or for a whole day session. That way we can be able to flesh out, identify where we can work together. As I said earlier, we really need to collaborate. We need to work together so that we can have SHA being a success and UHC really being a success in Kenya. So we appreciate the comments and we look forward. My team and I will be reviewing and giving you a date and possibly just to engage and see at your own convenience when we can convene and discuss, deliberate further so that we can really ensure that Taifa Camp is a success.
Thank you, Cabinet Secretary. I think, Cabinet Secretary, you've made quite a number of commitments to this House. We would expect you to provide a written response to all the matters that were raised by the senators, the ones you did not have adequate answers to. And also, you had made a commitment to provide a report of KEMSA and the other reports that you've committed to, which we'll expect that you give it in 1 week. Let us, honorable senators, now proceed to the next question by Senator Hamida.
Thank you, Mr. Speaker. My questions, Madam Waziri, as follows. Number one, have medical interns been paid their monthly stipend their monthly stipend up to date? And if not, could the Cabinet Secretary explain the delay and state when the government will streamline the process to guarantee timely payments? Number two, what is the ministry doing to improve the working conditions for medical interns who currently handle heavy workloads and work for extremely long hours under intense psychological pressure? Number three, could the Cabinet Secretary provide an overview of the support systems and programs currently being implemented by government to address the physical and mental well-being of medical interns? Number four, could the Cabinet Secretary also explain what the government is doing to ensure that the mentorship program of medical interns effectively integrates both professional development and emotional support? I thank you, Mr. Speaker.
Cabinet Secretary.
Honorable Speaker and members of the Senate, in the financial year 2023-2024, the ministry was to post 3,759 interns as per the matrix below at a cost of 4.8 billion for the 12 months, but there was no budgetary allocation for the second cohort that was to be posted in January 2024, and this delayed the posting. The ministry consequently requested the National Treasury, with our letter reference number MOH Fin Budget Volume 1, 15, dated 12 September 2023, for additional funding to cater for posting of the aforementioned second cohort, which the National Treasury, with their letter Res 1083-2301A of 9th October 2023, indicated the funding could not be availed due to the tight fiscal space. following the end of the industrial action by Kenya Medical Practitioner Dentist, Pharmacy and Dentist Union, which culminated in the signing of the Return to Work Formula on the 8th May 2024, the parties engaged in negotiation on the matter of posting interns. The negotiations resulted in an agreement to post the interns with effect from 1st August 2024. Further negotiations on the payment of interns saw the parties agree to effect payment as per CBA 2017 rates. With regards to the government's effort to streamline the process and ensure timely payment, the ministry has formally engaged the National Treasury to facilitate the prompt and adequate release of funds to support seamless operation. And the ministry is working closely with stakeholders to establish a clear, pre-agreed framework for the posting of interns and the modalities of their engagement, ensuring efficiency and predictability in the process. Regarding what the ministry is doing to improve the working conditions, Honorable Speaker and members, the Ministry of Health is working with the KMPDC, and it has implemented a range of policy and regulatory interventions to safeguard the mental health, well-being, and overall welfare of medical personnel, particularly medical interns, taking note of the strenuous nature of their learning context. The key measures undertaken include centers to appoint dedicated personnel responsible for conducting regular mental health screening and ensuring access to qualified mental health professionals. These professionals provide essential guidance, training, and psychological support to interns, fostering a healthier work environment. This initiative has greatly improved mental health awareness among healthcare providers and the broader medical community, reinforcing the importance of mental well-being in high-pressure clinical settings. Furthermore, mental health professionals stationed at training centers play a vital role in supporting interns, offering timely interventions and addressing emerging concerns. To enhance coordinations, these professionals have been working closely with KMPDC in managing cases that require specialized mental health interventions. Secondly, there's enhancement of welfare and support mechanism, and all healthcare institutions are mandated to establish comprehensive welfare programs, including structured mentorship framework, chaplaincy services, and peer support structures. These measures aim to create a conducive work environment where medical personnel may freely express professional concerns without fear of victimization, reprisal, or undue prejudice. Thirdly, regulation of workload and rest periods. In strict adherence to the Employment Act 2007, the Occupational Safety and Health Act 2007, and other applicable labor and medical internship regulations, the Ministry and KMPDC require all health facilities to monitor and regulate interns' working hours. These measures are designed to prevent excessive workload and mitigate the risk of occupational burnout. Through these initiatives, the Ministry reaffirms its commitment to safeguarding the psychological well-being of medical interns, ensuring they receive the necessary support to navigate the demands of their training effectively. Part C, where you ask for us to provide an overview to the support system and the program currently being implemented by the government to address the physical and well-being of interns. Honorable Speaker, honorable members, the Ministry of Health in Kenya has implemented several initiatives to support the physical and mental well-being of medical interns. First of all, we developed the National Guidelines on Workplace Mental Wellness. That was in October 2024, and these guidelines aim to promote mental well-being and establish robust support system for employees and health professionals in training, including medical interns facing mental health challenges. The ministry advocates for mental health prioritization in workplaces, calling for the united effort, urging investments in mental health clinics across level 4 hospitals, the implementation of these guidelines by employers, and the incorporation of mental wellness programs into school curricula. Secondly, integration of mental health into primary care. Acknowledging the shortage of mental health professions, the ministry has taken proactive steps to integrate mental health services into primary health care. This strategy enhances access to mental health support, ensuring that individuals, including medical interns, can receive timely interventions within community-based healthcare settings. By embedding mental health services into primary care, the ministry is equipping frontline healthcare providers with the necessary skills to identify, assess, and manage common mental health conditions. This approach strengthens early detection and intervention, reducing the burden of specialized mental health facilities. Medical interns in particular benefit from this integration as they receive both training and direct support in recognizing and addressing mental health challenges. This initiative fosters a more supportive and responsive healthcare environment, promoting overall well-being. Additionally, the ministry is working to enhance collaboration between mental health professionals and primary care providers to ensure seamless referral and comprehensive care for individuals in need. Thirdly, clinical guidelines for mental disorder. In July 2024, the ministry launched Kenya's first clinical guidelines for mental disorder. These guidelines, along with the Mental Health Gap Action Program e-training, aim to improve the identification, diagnosis, and management of mental health conditions, thereby enhancing the support available to medical interns. In addition, the guidelines for the management of common mental disorders, along with the Kenya-adapted version of the World Health Organization Mental Health Gap Action Program, aim to close a 75% treatment gap by improving the identification, diagnosis, and management of mental disorders at the primary care level. They include comprehensive strategies for diagnosis, treatment, and referral of clients, including medical interns who may require these services. For oversight and regulation, the KMPDC, in collaboration with the Ministry of Health, is responsible for enforcing clear guidelines on working conditions and hours for medical interns. This oversight ensures compliance and accountability across healthcare facilities, aiming to improve the working environment for interns. These initiatives reflect the government's commitment to enhancing the physical and mental well-being of medical interns through comprehensive support system and programs. Regarding what the government is doing to ensure the mentorship program of the medical interns is effective, integrated for both professional development and emotional support, Honorable Speaker and esteemed members, the Ministry of Health has undertaken several initiatives to enhance mentorship programs for medical interns by integrating both professional development and emotional support. Recognizing the demanding nature of medical training, these efforts aim to create a well-rounded support system that fosters both clinical competence and mental well-being. A key component of this approach is the ministry's collaboration with KMPDC to strengthen mentorship frameworks. Through these partnerships, structured mentorship programs have been designed to provide guidance on career growth, ethical practice, and professional development, while also addressing the emotional challenges faced by interns. These initiatives include training of internship coordinators and supervisors, where the Ministry and KMPDC have instituted mandatory training programs for internship coordinators and supervisors across all accredited healthcare institutions. These programs are designed to equip mentors with the necessary skills to provide structured guidance, supervision, and psychosocial support to medical interns throughout the internship period. Secondly, oversight through the Fitness to Practice Committee. The Fitness to Practice Committee of KMPDC plays a pivotal role in monitoring and evaluating the professional and ethical conduct of medical interns. Through this framework, the Council maintains a structured follow-up mechanism that extends beyond the internship program, ensuring that medical practitioners receive continued professional oversight and mentorship as they progress in their careers. These measures are part of a broader strategy aimed at strengthening internship training, fostering a supportive learning environment, and enhancing the overall quality of medical education and professional practice in Kenya. The ministry remains steadfast in its commitment to upholding high standards of medical training and mentorship in line with statutory and regulatory provisions. Thirdly, national guidelines for internship training. The KMPDC has developed comprehensive guidelines for internship training. These guidelines emphasize the importance of mentorship in fostering professional growth and ensuring the well-being of medical interns. They outline the competencies and skills to be acquired during the internship period, providing a structured framework for both professional and personal development. Through this initiative, The ministry aims to provide a holistic mentorship experience for medical interns, integrating professional development with emotional and psychosocial support to ensure their well-being and effectiveness in healthcare system. I submit.
Thank you, Cabinet Secretary. Senator Hamida, your supplementary question.
Just a quick question. I was just thinking, Madam CS, by the time you implement what you have addressed us, the interns would have lost hope, and you know what it is with them. Of course, they die, they kill themselves. And I'm just wondering, does SHA cover psychological therapy sessions? Because that's what they require now. And since we don't want to lose any more lives, since they're still claiming they sleep hungry and they have no hope. Thank you.
Cabinet Secretary.
Thank you, Honorable Speaker and Honorable Member. One of the great achievements we have under the Social Health Authority's coverage of mental health disorder, and we are happy to report that it is incorporated, and under SHA, the medical interns can access mental health services, including rehabilitation of substance abuse disorders.
Senator Hezena, supplementary question.
Thank you, Mr. Speaker. First of all, I want to appreciate the Cabinet Secretary. I know we must give Caesar what belongs to them, despite the grilling today. Because following the statement I made on the cancer center and the prevalence of cancer in Samburu, sometime late last year, I had a very proactive response from the Cabinet Secretary where her entire team and the cancer National Cancer Center went to Samburu. They had a 3-day screening exercise, I think, across the 2 constituencies, Samburu East and West, which I truly appreciate. But I think next time, you need to involve political leaders or grassroots leaders, even like the chief and the DCs, so that they can mobilize the community, because Samburu County is a place where there is people are scarcely populated, and we needed to do mobilization for people to travel. And I know you are very surprised because you were at the town centers like Wamba and Kisima and Maralal, and it was having a low turnout because you didn't mobilize in time. So I hope you do this exercise again, as you have seen that it is truly a disaster in Samburu. Secondly, I appreciate you for launching the oncology center in Samburu County. I'm sorry I couldn't attend because we had a burial as senators. And we are very proud as the oversight body when we see leaders in the executive taking very proactive measures. And we hope with the same breath that the things you've promised, you're going to move with speed. So that girl child is not underestimated. In my supplementary question, I would like to know if there are any measures you're taking towards ensuring that mental health is addressed among the youth. You know very well that the people I represent are the population that is largely affected by mental health. And there was a statement I did on requesting the ministry to ensure that we have mental health desks in all public health centers and hospitals to ensure that at least even citizens know that there's something called mental health, and they can walk into a health facility and seek mental health services just like they seek help for any other illness or ailment. Lastly, I would like to know from the Cabinet Secretary.
Senator, you're only allowed one supplementary question.
I think it's related, Mr. Speaker.
But only one question. And I also gave you a lot of leeway in giving your long story about Samburu County. So can we allow other senators to ask a question?
Thank you, Mr. Speaker. It's important to show gratitude so that Kenyans know what steps are being made. We can't criticize without showing gratitude. Thank you, Mr. Speaker.
Thank you,
but
Senator.
I beg you to just ask this question
Very
because
well.
it's related.
Very quickly, please.
My mic. I would like to know if, it is very essential for public health facilities to have proper hygiene. Is the ministry working in collaboration with other organizations or have any programs to ensure that water is provided in public health facilities? Thank you.
Senator Mohammed Chute.
Thank you very much, Honorable Speaker. Let me thank the CS for being here today. And sometimes I wonder how she's going to manage this ministry. And I don't know if she has thought of even resigning because the situation.
Senator,
yes.
Senator Chute.
Yes. Okay.
Ask your question related to the principal question that was raised by Senator Hamida and stick to the question only, please.
Honorable Speaker, it is related because of the pressure the CS is facing. Anyway, let me go back to my question, Honorable Speaker. Honorable Speaker, the question I have is there is an outbreak of Kalaza in both Logologo and Laisamis. I wanted to know if the minister is aware and what action has he taken. And again, Honorable Speaker, I have two patients, one in Nyeri, one in Isili. The one in Nyeri died last week. My condolences to the family. But what I came to know, Honorable Speaker, is SHA is paying for bed and also surgery only. I want the Cabinet Secretary to tell us what happens if somebody is admitted in the ICU and also other costs, which is doctor's cost, and other related costs. How is SHA going to honor those payments? Thank you very much, Honorable Speaker.
Senator Kavindu.
Thank you, Mr. Speaker, for this opportunity. Mine is just a confirmation from Madam CS, Honorable CS. If SHA is covering mental health and drug abuse related issues, because that is very common in our villages. And these people pay for SHA, and I want to know if this is covered by SHA. Thank you, Madam CS.
Can we allow the CS to answer those three questions and then take the other questions? CS?
Thank you, Honorable Speaker and honorable members. For mental health among youth as a national, we have been able to develop guidelines and also have strategies and action plans to ensure that mental health is addressed, not only for the youth, but population across. And as said earlier, we have the national guideline on workplace mental wellness. We have, again, we are working on integration of mental health into the primary care, utilizing our interns, medical interns, and other healthcare professions in order to identify mental illness earlier, and again, institute interventions or also improve the referral mechanism. Equally, we have the clinical guidelines for mental disorder. That way they can be implemented at county level. And we have the, again, oversight and oversight of the same on mental health illness. So it is something that we are working, and we hope to collaborate and also ensure that there's implementation at county level. Regarding the water, sanitation, and hygiene component, yes, we are working together with the ministry as well as county and stakeholders to ensure that our health facilities, including our primary health care facilities, have the wash component is addressed. And we even have guidelines and monitoring assessment for healthcare facilities where we conduct to ensure that water, sanitation, and hygiene is up to, capacity in order to avoid the spread of infection. For Kalaza in Marsabit, yes, Kala-Azar is a neglected tropical disease caused by Leishmania parasite, and Marsabit has reported 19 cases since 2025. And what we are doing is sensitizing the communities on Kala-Azar and other forms, and also having case management focal points at Marsabit, at the hospital, in order to treat and also improve the surveillance and continuous detection of these cases, so that we can be able to control whenever there is a concern. Regarding vector control is another area that we are looking into, as well as capacity building healthcare workers in matters detection and management of Kala-Azar. We also have medicines available for the treatment of the condition, and implementation is ongoing. I believe that, as we had said earlier in the committee, we will be able to share a comprehensive report, which will also incorporate the various benefit packages, as well as the improvement that has been done with regards to the intensive care unit, that is the ICU, among others. For mental health and substance abuse, yes, we are happy to report that SHA actually covers, unlike NHIF, mental health and substance abuse rehabilitation. And we are seeing many Kenyans taking up this service, and even when given the time, next time we'll have a comprehensive report on that as well. I submit.
Senator Kavindu, what's your point? What was your point of order?
Chair, actually, my Honorable CS has already answered that SHA covers. But sometimes when you are trying to interact and calling to get interventions from you, Honorable CS, we can't get through to you. Kindly answer our calls, because we have issues. Like I had somebody who had died in KU from December, and we needed your intervention, but we could not get you. Thank God for the CEO for SHA and the CEO KU. They intervened.
Thank you, Senator Kavindu. What is your point of order, Senator Chute?
Honorable Speaker, I asked a question about payment on SHA, on the issue of medical and also ICU. I didn't hear that answer. And number two, Honorable Speaker, the CS didn't tell us about prevention of Kala-Azar. How is he going to help us in preventing either fumigation-wise and all those things? The most important thing, Honorable Speaker, is prevention of Kala-Azar.
Thank you, Senator. Cabinet Secretary, are you able to respond to those two issues?
Yes, thank you very much. So, first of all, NHIF did not cover ICU. When we had started implementation of the Social Health Authority and Social Health Insurance Fund in October, ICU only covered 4,600 per day. Currently, we have reviewed, and now we'll be covering 28,000 Kenya shillings per day. And so we want to assure you that a lot is ongoing in the review of the benefit package to ensure that we are improving and it's meeting the needs of Kenyans. With regards to prevention, a lot has been done. We've had the guidelines for prevention and management of Kala-Azar. We have advocacy. Again, we are having advocacy. We are utilizing the community health promoters. And also knowing that health is devolved, we are also working with the county government to ensure implementation of preventive strategies such as vector control, among others. Thank you.
Senator Chute, I'm aware that you have put a request for a statement regarding that disease. Are you seeking to drop that statement so that you can get the answers right now from the CS? No, Senator Chute, I will not allow. No, Senator Chute, we will not dwell on your.
Let me answer that question, Honorable Speaker.
First of all, Senator Chute.
Yes.
I allowed you to ask the question, and you did not ask a question related to the questions raised by Senator Hamida. And you already have a request for a statement. So can we just agree that you're going to raise your statement and you will get the adequate answers at that time? Allow other senators to ask their questions. Senator Chute, Senator Cherargei.
Thank you, Mr. Speaker, sir. Following up with the question of interns that Senator Amida has asked, in April 2020, at the height of COVID pandemic, Waziri, Madam Baraza, 9,000 interns under universal health coverage were given a contract for 3 years. In April, I think in 2023, through the Speaker, the summit sat in Naivasha and extended through 3 years of the 9,000, the Speaker that fought and assisted her in the fight against COVID in 2020. My question, Madam Waziri, under Article 41 and Labor Relations Act and the labor laws of this Republic, what is the fate of universal health coverage of more than 9,000 interns that were hired under the ministry and in partnership with the county governments, because I'm aware health is devolved? And is this a silver bullet in finishing the many strikes that we normally see outside Parliament of doctors, of nurses, of any kind of medical practitioners? Is the ministry in the process of transiting them to permanent and pensionable, because we are violating the constitution of Article 41 of Constitution of 2010 of Kenya by having these interns, of being interns for the last 6 years? Is it fair, Madam Waziri? Can you confirm to the House that there is a proper rollout on permanent and pensionable rollout between the Ministry of Health and also the county, so that we protect the young people, Mr. Speaker? So that's my question on interns under UHC.
Thank you, Senator Cherargei. Honorable Senators, I see there's a lot of interest in asking questions to the Cabinet Secretary. With your indulgence, could I propose that we allow the supplementary by Senator Cherargei to be answered by the CS? We move to the question, the next question by the Senator of Kirinyaga, and then we take all the supplementaries after the question of Kirinyaga, and we can ask any question. Is that in order? Thank you very much. Senator, Cabinet Secretary.
Thank you, Honorable Speaker and honorable members. So first I need to highlight that they are not interns, they are actually employed on contract, and their contract has been extended. So there are 9,918 healthcare professions who comprising of 16 different cadres who were recruited 3 years on a 3-year contract in May 2020 under UHC. They were deployed across all counties and national government health facilities where they were remunerated at a consolidated pay of 50,000 and 40,000 per month for diploma and certificate holders respectively. And upon expiry of their contracts twice in 2023 May and May 2024, renewals were effected, culminating to the latest one that will come to a close in May 2026 to allow time for finalization of their absorption into permanent and pensionable terms to the counties where they work. The cost of translating is there. For permanent and pensionable is 7.7 billion. And so we are working together with the county to see how we can absorb the UHC staff into permanent and pensionable. However, at the moment, they have their contract until May 2026.
Thank you, Cabinet Secretary. We move to the next question, question number 14 by Senator James Morango.
Thank you, Mr. Speaker. Mr. Speaker, my question is very short, and I want to maybe to say that I am contented with the answer that I got from the Minister. However, I'll just go ahead and read it. Question number 14. Could the Cabinet Secretary highlight the programs in the health sector that will be affected by the decision by the American government to withdraw funding from aid-funded healthcare programs in the country, with particular focus on how such withdrawal affects the health sector in Kirinyaga County? Number B, could the Cabinet Secretary provide a breakdown of the budget for the affected programs in the country? And C, what action is the Cabinet Secretary taking to ensure that critical services under the affected programs do not stop and thus avert the likelihood of putting healthcare in jeopardy, both in the counties, and at the national level? And Mr. Speaker, I have no supplementary question. Thank you.
Thank you, Senator. Cabinet Secretary.
Honorable Speaker, honorable members, the recent withdrawal of funding by the American government following the issuance of Executive Order number 14169 has had profound and far-reaching consequences on several critical health programs in Kenya. This abrupt shift in financial support has disrupted essential services, ongoing initiatives, and placed an immense strain on our healthcare system, particularly in the areas that rely heavily on official aid. The affected programs include HIV/AIDS program. The withdrawal of funding affects the provision of life-saving antiretroviral therapy for over 1.4 million Kenyans living with HIV in the country. In Kirinyaga County alone, 12,345 people living with HIV, with 10,456 currently receiving ARTs. Furthermore, critical lab commodities for early infant diagnosis and viral load testing are at risk of stockout, jeopardizing the timely detection and monitoring of HIV in newborns and patients on ART. Again, the malaria control program, the recent funding freeze has disrupted the distribution of critical malaria control commodities across multiple counties, including Kirinyaga, which is marked for malaria elimination. These include insecticide-treated nets, rapid diagnostic test kits, and preventive treatments for pregnant women. This setback poses a significant risk to malaria-endemic regions, particularly in counties with high transmission rates such as Kisumu, Migori, Kakamega, and Tana River. Without timely intervention, malaria cases and related complications could rise, undermining progress made in reducing malaria-related morbidity and mortality. The family planning program, the withdrawal of funding has significantly impacted the availability of essential family planning commodities nationwide. Stock levels of contraceptives, including implants, injectable contraceptives, or pills, have dropped below the required minimum, affecting both public and private facilities. This shortage threatens the ability of women and families to access reliable family planning services, with potential implications for maternal and child health outcomes, particularly in countries with high unmet contraceptive needs such as Nairobi, Bungoma, Nakuru, and Kilifi. For vaccines and immunization programs, the funding freeze has disrupted the procurement of critical vaccines, affecting approximately 5% of Kenya's total vaccine supply, amounting to 585 million Kenya shillings. Counties with large immunization coverage gaps, such as Turkana, West Pokot, Mandera, and Garissa, face heightened risk of vaccine-preventable disease outbreaks, and this reduction in funding threatens Kenya's ability to sustain its routine immunization programs and respond to emerging public health threats, potentially reversing hard-won gains in child health. Kirinyaga County risks reversing their 10 vaccination coverage of 93% for pentavalent, 91% for oral polio, and 87% for BCG against a national coverage of 72%. Nutrition program. The withdrawal of funding has disrupted the supply of life-saving nutrition commodities, including therapeutic foods used to treat severe acute malnutrition in children under 5. Counties with high rate of malnutrition such as Marsabit, Samburu, Kitui, and Baringo are particularly affected, putting thousands of vulnerable children at risk of severe health complications. And without urgent intervention, malnutrition-related deaths could increase, exacerbating the already critical burden of food insecurity in drought-affected regions. Kirinyaga County is flagged nationally for overweight and obesity challenges, particularly amongst the reproductive age women, at 65% being the highest in the country, and is therefore a target for intervention by the ministry's NCD campaign. For human resource for health, the funding freeze affects 41,547 health workers supported by PEPFAR, including those deployed in Kirinyaga County, and the county has submitted to the Council of Governors a list of 159 affected frontline health staff who are spread across 3 projects: LVCT, the BT project, Christian Health Association Uzima project, and Wezesha Afya project at a cost of 4.7 million per month. Despite the freeze, services continue for now due to the implementation of a waiver. Could the Cabinet Secretary provide a breakdown of the budget for the affected programs? Honorable Speaker, honorable members, the total budget for the affected program in the financial year 2024-2025 is 79.8 billion, and the breakdown is as seen in the table. Actions taken to ensure that critical services under the affected programs do not spot and that we avoid the likelihood of putting healthcare in jeopardy both in counties and the national. Honorable Speaker, honorable members, the Ministry of Health has undertaken the following measures to mitigate the impact of funding withdrawal. Number 1, emergency funding. The ministry has requested an emergency allocation of 33.5 billion to fill the funding gap and sustain critical health programs, with the breakdown given below. And secondly, diplomatic engagement, where high-level bilateral discussions with the U.S. government are ongoing to clarify and implement the waivers on essential health services. It is, however, important for the Senate to assume a worst-case scenario and support the ministry meet the budget gaps through resource allocation for affected programs at the national and county level. Reallocation of resources, the ministry is prioritizing reallocation of domestic resources to sustain critical programs, including HIV, malaria, family planning, as captured in the budget policy statement for financial year 2025-2026. Again, strengthening local systems where efforts are underway to strengthen domestic health financing mechanism, including the Social Health Insurance Fund, to reduce dependency on external donors. For example, premium insurance financing to net in informal sector economy through cooperatives is underway. Commodity distribution, the ministry is engaging Global Fund to expedite the procurement of essential commodities and ensure their distribution through KEMSA. This is Annex 3, stock status for ARVs and vaccines, including stock pipeline as provided by KEMSA. Data system integration plans are underway to integrate health data system into the national digital health infrastructure to ensure sustainability and data security. Affected systems to be integrated include chanjo.ke for vaccination, damu.ke for blood collection, tibu.ke for TB, digimal.ke for malaria, and KHIS. I submit.
Thank you, Cabinet Secretary. Honorable Senators will now take supplementary questions. Senator Mandago, do you have a supplementary question?
Thank you very much, Honorable Speaker. I don't know whether it will be a question or just a comment, especially on the matters of interns. Honorable Speaker, I think the ministry should really work on the budget. But we also do understand that the issue of training of medical staff, human resource, is both by private and government. What I would like to know is, why should the government take responsibility for interning medical officers who are trained in private facilities who were not captured in the budget of the national government through trainings in public institutions? So I would want to ask the ministry, what are they doing to make sure that we don't get these emergency budgets that result from actions that are not from the ministry or properly budgeted for, so that we are able to cater for internship effectively through forward planning, Honorable Speaker.
Senator Mazayo.
Thank you, Mr. Speaker. Mr. Speaker, sir, I want to find out from the CS, is it true that on 20th of February this year, the Rural and Urban Private Hospitals Association of Kenya, RUPA, issued a statement suspending the services under SHA except for emergency cases beginning Monday, 24th of February, 2025. Alleging arrears worth 30 billion. Additionally, the Kenya Association of Private Hospitals, CAP, issued a directive on the 24th of February 2025, resolving to indefinitely suspend all credit arrangements under SHA due to the outstanding NHIF arrears. Now my question would be, what is the government doing to ensure restoration of the essential medical services? The second question, just as a second question, which is very short. Following the suspension of the services under SHA of the two associations, that is RUPA and CAP,
Senator
what
Mazayo.
measures has the ministry?
Senator Mazayo, can we allow the CS to answer the first question so that you can establish if actually SHA has been suspended as per your question?
Yes,
and
I
then
can.
you can come to the second
I'm most obliged.
question.
I stand
Thank
guided.
you.
I stand guided. I'm most obliged.
Senator Essie.
Thank you, Mr. Speaker. I've been listening. I had a separate question, but you'll allow me to just comment on the response. I've been listening to what the Cabinet Secretary was responding towards the USAID freeze, and I would wish to ask, then, apart from the emergency funding and diplomatic engagement, what other alternatives are you proposing? Because it appears that we are not having a proposal on how we can cater for that. What if the engagements do not go our way? Are we going to watch people die while every other day I'm reading reports of budgeted corruption in different offices in this country, Mr. Speaker? Thank you.
Senator Essie, I can also answer that question for you because the CS did actually respond to that. If you were listening to the response by the Cabinet Secretary.
I was listening and I actually indicated here. From what she articulated, I do not see a direct proposal on we as a country.
The first proposal was request for emergency funding,
So
which
if-
they have already put to the National Treasury.
So if we are having that request, why then do we need the donor funding to us? We can reorganize our money and sort out ourselves.
Very let's allow the CS to answer those three supplementary questions, then we'll take the other supplementary questions. Yes, Mazayo, Senator Mazayo.
With your kind permission, Mr. Speaker, I thought mine was just a two sentences question.
Yeah, she's going to respond.
Which I wanted to sum it up so that it goes together with it, just in case, whichever way she answers, and it sorts
Okay,
out,
very well,
then
Mazayo.
I'll be most obliged.
Let's save time and go ahead,
Yes.
ask the question.
Yes. Now, following the suspension, Madam CS, following the suspension of the services under SHA of the two associations, that is RUPA and CAF, what measures has the ministry taken to mitigate? Should a patient in Bamba, which is a very remote area in Kilifi County, be denied medical services which they are fully paying for every month?
Thank you. Cabinet Secretary, if you could respond to those few questions first.
So with regards to Senator Mandago's question, we are finalizing on HRH and interns policy, which again will capture the concerns that have been raised. Additionally, for the question on USAID and what we are doing, we have, as has been said earlier, we have the emergency funding, diplomatic engagement, we are reallocating resources and strengthening our local system, commodity distribution, as well as integrating the data system. And again, maybe one thing we forgot to talk about is integration of the various programs that were fragmented into the broader health system. I believe that is one of the areas that we can curb, reduce on the resources that have been leaking. Additionally, partnering with other, member states that would also wish to support, so we are engaging in those levels. With regards to the RUFA, we had given a statement earlier, and yes, we acknowledge the NHIF debt, and we are working, because that is really the highlight or the priority that they are talking about. And so we are looking into a payment plan, and the resolution process is ongoing. But what we want to assure Kenyans is, even this week, 5.1 billion was given to the healthcare providers for the Social Health Insurance Fund, and this is totaling to 18.29 since the rollout in October 2024. And for primary healthcare, we've disbursed 1.3 billion. Again, we are compiling returns from healthcare providers to facilitate the release of the PHC in the second quarter, and to ensure an efficient payment process, as well as we are training the various RUFA, the other facilities on the issue of the PHC reimbursement, the new model, for them to understand of why it is a better kind of a model compared to what we had previously. But we are committed to honoring the undisputed NHIF claims, and the finalized NHIF pending claims again are undergoing reconciliation. We acknowledge that the private hospitals, the RUFA and the CAF are really critical in providing healthcare services, and for us to meet Taifa Care, which is affordable, accessible, quality services to all Kenyans, and we continue meeting and discussing and engaging to see how we can improve services for all Kenyans.
Cabinet Secretary, before you sit down, Cabinet Secretary, there was a second part of the question by Senator Mazayo on what mitigation measures have been put in place considering the suspension by these two associations to provide services to the people of Bamba. Very well, Senator Mazayo.
Asante Bwana Spika. Bwana Spika, unafanya vizuri sana kuweza kunisaidia hapo, kwa sababu swala hilo alikuwa bado waziri hajaweza kulijibu kisawasawa ama kulijibu kabisa.
Ndio nilikuwa nakukumbusha
wale watumishi wa hiyo hii RUFA na RAF, ikiwa hivi sasa imekataliwa, wizara yako inafanya inachukua hatua gani kwa wale ambao ni watumishi wa hii ambao wanaishi sehemu mbalimbali kama Kilifi? Unavyoelewa, Kilifi ni kaunti moja kubwa katika Kenya, na sasa wako wale wanaotumia hiyo ridhaa ambao iko Bamba, na wale watu wa Bamba sasa imekuwa hii haifanyi kazi. Ikiwa ni hivyo, wizara yako imechukua hatua gani kuona ya kwamba wale ambao hawapati services kama hizi wanaweza kuzipata wakiwa huko Bamba, Kilifi County?
Waziri.
Asante sana. So tunajadiliana na RUFA na CAF kuona vile tutaweza kurekebisha mambo ambayo yalikuwa zamani, ndiposa Wakenya wapate kuhudumiwa. Sasa hata kutakuwa na wataweza kukutana na PS na hiyo timu ya SHA kujadiliana na kuangalia hayo maneno. Tunataka kurekebisha na kutatua haraka sana hiyo maneno. So again, I believe that this is again a time that we need your support, Honorable Speaker, honorable members. In terms of improving our public facilities, what you notice is at the primary healthcare level, the dispensary and the health center facilities are not well equipped in order to improve.
Just a moment, Cabinet Secretary. Yes. Nini hoja yako ya nidhamu?
Speaker pengine aweza kuwa hajui, lakini ukianza kutamka ama ukianza kusema kulingana na kanuni zetu za kudumu katika bunge la Senate, ni kwamba utatumia lugha moja. Kwa vile umeanza kuongea Kiswahili, ingekuwa bora zaidi uendelee kuongea Kiswahili mpaka umalize. Sio kuenda ukifika katikati unawacha panda njia, unafuata panda njia ingine. Hiyo Bwana Speaker, tunaona kwamba hairuhusiwi katika kanuni zetu, na ingekuwa hivyo.
Senator Mandago, what is your point of order?
Madam Waziri aweze kujibu swali kama hilo.
Mheshimiwa Speaker, ningeomba Senator mwenzangu Mazayo asitumie fursa ya yeye kuwa na ufasaha wa lugha ya Kiswahili kuzuia waziri kutoa taarifa ambaye anaweza kumfaidi yeye kwa lile swali ambayo ameuliza. Ya pili, Mheshimiwa Speaker, waziri si mmoja wa seneta katika jumba hili, na kwa hivyo kanuni za nyumba hii haifai kushurutishwa kwa waziri. Apewe nafasi kujibu swali lililoulizwa.
Asante Senator Mandago. Senator Mazayo, hakuna kitu ya Senator Mazayo, tu hatuna muda ya kujibizana. Mpatie mic, mpatie.
Kulingana na kanuni zetu za kudumu, na Speaker, wewe peke yake ndio unaweza kuniuliza mimi, je, ninahitaji kuambiwa kitu chochote na ndugu yangu Senator Mandago, kama nilikuwa sikusema kisawa sawa. Kwa hiyo alivyosema yeye, si haki ya yeye kumjibu seneta, hata kama yeye ni mwenyekiti wangu katika hii kamati ya afya, lakini yeye hana ruhusa, hawezi kuvunja sheria za kanuni za kudumu ya hii bunge la Senate. Kwa hiyo Bwana Speaker, waziri ni lazima azingatie kwamba yuko katika nyumba hii, na yeye akiwa katika nyumba hii ya Senate, kama kanuni zinasema ni Kiswahili akianza ama ni Kizungu akianza, amalizie hapo akijua kwamba yeye pia yuko chini ya hizi kanuni za kudumu la bunge la Senate.
Asante sana Senator Mazayo, na nafikiri Senator Mandago alisimama kwa hoja ya nidhamu, si hoja ya kukupatia information. Na alivyosema Mandago, mimi kama mwenyekiti nakubaliana na matamshi yake, kwa ajili sheria zetu zinasema seneta akianza kwa lugha moja aendelee na kumaliza kwa lugha moja. Na mimi kama mwenyekiti nilimpatia nafasi waziri kujibu kwa lugha ya Kiswahili na alafu akaendelesha kwa lugha ya Kimombo, ambao niliona kama mwenyekiti iko sawa. So hiyo hoja yako Bwana Senator Mazayo tutaweka kando, tuende kwa maswali zingine. Senator Abbas Sheikh Mohamed.
It took a long time, one hour. Minority Leader. Honorable Speaker, I think mine is a clarification. Many has been said. One is that according to SHA, they're only paying now currently for the services on the bedding when somebody admitted and surgeries. By the time somebody goes to ICU, they have not yet started paying. So I wanted to know, it's also medication. Even though somebody goes to surgery, definitely somebody has to be given medication. The same is not been paid for. And this is the same question my colleague was asking the other time. So when will the ICU payment and medication start for SHA? Because last time we have been told it will start around April this year. Is it still on course, or you have done away with it? 2, there's this group called community health promoters. The community health promoters are a very important unit of the medical services. But however, those guys are poorly remunerated. They have no salaries, they're only given allowances. The community health promoters are poorly paid. They only get 5,000 allowances. In the areas like Wajir and Mandera and Garissa, the area is just so vast. Is there any other plan? Because there's no way of even reaching, making the outreach programs. These guys cannot be walking from place to place. It's not like Kiambu or Nairobi, where you can go by matatu. So what is the ministry doing, or what plan is there for health promoters to be facilitated, especially in terms of transportation? And even looking into their welfare, especially what they pay, that allows them to pay 5,000, delays for 3 months, 4 months. Thank you, Honourable Speaker.
Thank you, Senator Mofaya.
Honourable Speaker, you know we are live. We are streaming live. I've just received a concern from Marimanti Level 4 Hospital, which is in Daraga constituency. I remember, Honourable Speaker, I posed the same question to the predecessor to the current CS concerning the CT scan machine and MRI machine for Marimanti Level 4 Hospital. This question, Honourable Speaker, might not be related to the previous questions that have been posed by my fellow senators. So, Honourable Speaker, Marimanti the facility, Honourable Speaker, is the only of its kind part of the Raganidi County that is a part of East, and it serves quite a number of huge population across some parts of Maua and some part of Kambani. It's the only facility, Honourable Speaker, and I think many people are traveling some far distances to seek MRI services and CT scan. They are going to places like Chuka, to Meru Town, and other far places. I remember this is not the first time, Honourable Speaker, that I've been able to question this matter. So I've just received information from Marimanti now because they are watching us live to get from the CS whether she is aware of those machines that are lacking, and those are very essential for Marimanti Level 4 Hospital in Daraga constituency. Is the ministry aware that this facility is not having these important machines?
Final question from Senator Joyce Korir.
Yeah, thank you very much, Honourable Speaker. Mine will not be a question, but just to congratulate the CS on a number of few steps that they have made within the ministry, and also encourage her to really find solution to these questions that has been running through the minds of Kenyans in terms of SHA and Honourable Speaker, and even the issues that she has answered pertaining the contract staffers who have been serving since 2020. Honourable Speaker, I want to say that we should put to an end. The Kenyans are suffering, especially the teachers and our officers who have been stopped from getting the services from a number of hospitals. These are not issues that we need to have a sideshow. We need to sit down. We need to find a lasting solution to these questions. I know the relevant ministries that we have in this country are supposed to guide our executive in terms of making sure whatever we speak is implemented to the letter. So I would want to urge the CS that these things or these stories that is happening within the social media, I want to tell him that there are real issues that are affecting Kenyans. Kenyans are not getting their services. Kenyans cannot be treated. A number of them are suffering in their houses, yet they have paid their monthly dues and they are not getting the access to the medication. So I want to say that it is time for us as Kenyans to up our game and really do what we are intended to do in those offices. Thank you.
Cabinet Secretary.
Yes, thank you, and we do take note. So I will start with the community health promoters. And what I will say is that it is work in progress. First of all, let us be cognizant of the fact that they had never received anything for many years, but we started the community health program, which is now 2 years old, and we've been able to pay them for this time, and even their stipend, the last one being end of January. So we are really working to ensure that they are paid. We have additional resources for an additional 7,000 community health promoters kits provision, and we will look into improving the program, looking into the facilitation component, and also avail more resources as time goes by. Regarding the Marimanti Level 4 Hospital, under the National Equipment Service Program, we want to assure you that the governor is able to sign the agreement and again map out and identify what equipments, including CT scan, MRI, among others, that he requires within the county, and that way this program will be able to support in ensuring that we have the equipments in various hospitals, including Marimanti Level 4. So the equipments are there, it's just signing the agreement, and then we can move towards ensuring. And what we can tell you, even as we speak right now, we have some CT scans which are coming into the country, and after they had signed, some of the counties will be receiving some of these equipment, so we can push on our side. Kulingana na Bamba, I think ningependa kuambia kuwa wizara inabidi kufanya watu, kuhakikisha kuwa watu watafikiwa na hii huduma ya afya. Na sasa tunafanya bidii na kile tunawaambia wajisajili, na pia wataonekana huko. Wizara itahakikisha huduma inafika hadi mahali wananchi wa Kenya wako ama mashinani. Yeah.
Senator Mofaya, what is your clarification?
I thought maybe I've captioned the response of the CS that already we have the machines already installed, only the governor who has not signed for them. Is that the correct record? Maybe I can request the governor to come tomorrow and sign for them and get them to Marimanti. Is that the position, Honorable CS? Maybe the governor is not aware.
Proceed, Cabinet Secretary. Proceed.
So I want to confirm that he has signed. Now it is work in progress on our side to ensure that the equipments reach the last mile. And so we are working on that. Yes. So we are waiting for the equipments to get to the country, and then now they will get to the facility.
Senator Abbas, what is your point of order?
Honorable Speaker, with all due respect to the CS, this is the same question she avoided to answer for Honorable Shute. That we said SHA is only paying for beds and surgeries. They are not paying for ICU services and medication. And the same time, again, when I asked the same question, she avoided it. Please, with all due respect, I want the Waziri to answer the question. No or yes.
Senator Joyce Korir, what is your point of order?
Okay, thank you very much, Honourable Speaker. Mine was just a clarity that I want from the Minister pertaining the stipends. Can she be able to give us the statistics of every county in terms of payment of stipends? Because a number of counties, including my county, has not paid stipends for the health promoters for the last 1 year. Can we get
Senator
that statistics?
Joyce Korir, I'm sure the CS cannot give you the statistics right now. Maybe later. Cabinet Secretary, respond to Abbas' issue, please.
Thank you. So regarding ICU care, yes, we were able to review the benefit package. We have incorporated the 28,000, and implementation is upon gazettement. So we increased from the 4,000 to 28,000. It will be gazetted. In matters of ICU medications, and among other services, what we are doing is reviewing the benefit package. Again, we have a benefit package advisory team which will not only review ICU, but other components that need to be incorporated in the benefit package. As we had said earlier, NHIF did not have ICU. Now we have ICU, and again we are increasing, and again we are looking to improve the diagnosis treatment among others. So what we had started with is the NHIF benefit package. Again, we were looking at the burden of disease in Kenya, which are the common conditions, which are the ones that cause death, which are the ones that cause catastrophic expenditure. And that is how we established our benefit package based on the resources we have at hand. But gradually what we are saying, we will improve the benefit package. And we need to be cognizant of the fact that this is not just a problem of Kenya. Even other developed countries also face this. UHC is a journey. Gradually we'll improve the benefit package, and gradually we want to ensure that Kenyans will be able to access services. For the teachers and police, we said that upon registration and contribution of the premiums at 2.75%, then they are able to access the services under the Social Health Authority. Previously, they had an enhanced scheme under NHIF, and that is actually one of the concerns that was...
Thank you, Cabinet Secretary. Thank you very much. And Senators, we have to appreciate that the Cabinet Secretary has spent quite a long time with us today. And also, we need to appreciate that she has answered the questions to the best of our ability. And Cabinet Secretary, I have to mention, I have sat here with many Cabinet Secretaries. I think you have done very well, and you've been very articulate in your answers. Of course, you were not able to answer all the questions in details, but you have made the commitment that you will provide it in writing, and we look forward to that. I would want to give you leave now and wish you all the best in your duties. Thank you, Cabinet Secretary. Honorable Senators, it is now 1 p.m., time to adjourn the Senate. The Senate therefore stands adjourned until later today, Wednesday, 26 February 2025 at 2:30 p.m.
It's really